born children, and children is for adult. Now, we also have this one. It's called a glucometer. The glucometer here is for kupima sukari. And we have the tuko na kitu yake ya kutumia strips, and then hapa tuko na precursor. Yeah. Sasa watu wamefurahia sana hapa mashinani, tunawasaidia. And then hapa tena kuna madawa. Nikienda kwa familia nipata kama mtoto ako mgonjwa, ninaweza pea kadawa akula akienda hospitali. Now advantage ya hii kitu tena, nikimpata mgonjwa kwa familia, nikirifa tu kitambo mgonjwa afike hospitali, all the details are there. So tunashukuru sana.
Besides the kits that we launched, we have also given them the smartphones. This smartphone, my team at the ministry has worked and we have an application on it. It's called EKIS. Dr. Ryan there together with Dr. Lanata, I think is outside. They've put all the smartphones that we have given out, there are 100,000. They have that EKIS application. And all the community health promoters have been trained on the EKIS. So the data they record on EKIS. That EKIS, Your Excellency, is linked to the facility. So whatever information that she will enter here, when we go to a facility, we should find the information. By the time the patient is arriving, the details are there. So ile maneno ya kufungua file, tumefunga. Tuko na file yetu mkononi.
Alafu watu wote wenye mnawasimamia all the 100,000 wako hapa. Sa alafu hii simu tena inanikumbusha. Ulikuwa umeenda kwa tuseme kwa SIGNET, Mr. SIGNET, alafu inanipea task ya kufanya. Nilienda, alafu hii simu inanikumbusha niende for follow-up. So tunashukuru sana.
And are you checking them at random, or you are just dealing with the ones who are feeling unwell? Come now, a family like this one, do you take time to take their vitals, find out how is their pressure, how is their sugar level, or you just deal with the ones who are feeling unwell?
No. Sasa nikikuja kwa hii familia, mzee ataniambia, "Si nipime pressure." Alafu mama namwangalia tena, alafu
asipokuambia wewe utamueleza
na waelezea niko na vitu kama hii, mkitaka ukijisikia wewe hauko mzuri ananiambia.
Ana usiwaambie ukijisikia, mwambie ni muhimu. Wewe sasa ukifika kwa hii boma, unaambia hii mzee ni muhimu tujue vile uko. Na hakuna shida kujua, kwa sababu kunaweza kuwa na maneno kwa mwili hayajulikana. Kama ikijulikana mapema tunaweza tafuta kinga. So mzee, kwa heshima unikubalie pime pressure yako, niangalie sukari, mama namna hiyo. Usiyetafuta wagonjwa. Hii program ni ya ile watu bado kuwa wagonjwa. Hiyo ndio maana yake, tuweze kuzuia. So don't go for those who are feeling unwell. Educate them on the need to know their status, so that kama kuna maneno iko kwa mwili na develop, inaweza kukabiliana nayo mapema.
Na tukikuja kwa pressure, pressure ikiwa normal iko kiasi gani?
Ikiwa normal inakuaga isipite 140/90.
Na sukari?
Sukari ifike 7 hivi iko normal. Ikipita 7 itakuwa imeenda juu. Ikikuja chini.
Na hiyo ni mtu ambaye hajakula ama amekula?
Inategemea. Sasa ile au chakula, sasa ile sukari inaenda chini ama inaenda juu.
So kama hajakula sukari inatakana iwe ngapi?
Isipita hata hiyo 7.5.
She's a doctor. So
when they go, they should know what is normal.
I thought they say 6.2. What is the normal?
5.5.
5.5.
Yes.
On when you are fasting.
When you are fasting.
When you have not eaten anything.
Yes. So it should not go below 5.5.
We'll continue doing a continuous training and education for them. Pole watashika. Yeah.
Then ukija kwa hiyo kiti yako, ni madawa gani ndio siko ndani? Because umesema mtoto ukimpata hako mgonjwa, unaweza kumpa dawa. So unampa dawa gani?
For now, nikikuja kama ako na dawa, ninaweza mpea waresi.
Okay.
Na zinc.
Kama ako na joto?
Kama ako na joto nampea paracetamol.
Then kuna dawa pia ya kudiwam.
Kuna diwam.
Okay.
Tuna diwam after every 3 months.
And deworming, see to anything that we have put dewormers for adults and for children. We begin there as a basic. Then also what we have put there is just OTC. There is nothing for anti-infective or anything. Just over the counter, anything that even somebody can walk to a chemist and buy. We have paracetamol, we have zinc sulfate and ORS for diarrhea in children, and we have the dewormer. Yeah.
But I think basically, Your Excellency, what we appreciate is that the commercial promoters has been operating in a very informal environment.
Yes.
But the Kenya Kwanza government is putting them in a formal structure.
Yes.
Which together with the ministry and COG will partner on taking them to courses now and orientating them so that they become more formal.
And especially this collection of data.
Yeah.
It's very important.
Yes.
So that we also know where we are as a country, and we also know the kind of interventions that are required. County by county. If you come to my home county in Nyeri, we have challenge with non-communicable diseases.
Yes.
Probably that is not the case in Kericho. I think with this program, we will be able to know what are the areas of intervention so that you specifically deal with the area that is applicable to that particular area.
Nice to meet you.
Salimia huyu. Wewe unasema kama wewe hapana mgonjwa. Umepona? So
we were here 4 days ago. Tukapata mtoto alikuwa na vira. Tukamtuma hospitali. Akapewa dawa ya homa. So anaendelea na. Now for today we are coming for follow up.
Huyu mzee umemwangalia pressure yake?
Tumemwangalia.
Iko sawa?
Anakuanga nayo but saa hii yako sawa.
Na mama?
Mama ako sawa.
Just by asking the details here, we can get them a chip with the health center, isn't it?
Yes.
And even Kaptatet, isn't it?
Yes.
Because it shares across all our county health facilities. Yes. The beautiful thing is that it hits to the county. What this is what we just told them will hit to the need. So that as you get to the hospital, you don't need even to queue. Because already your treatment has been got, prescription has been made by a doctor. So I think this is a huge, tremendous success.
It's a milestone. In fact, I've traveled wherever I have gone and I have asked. They are already on the ground.
They are there.
Yeah. You know, I asked to in church, have these people come with the new? Yes, they are coming to work. So that is very, very important. And I think in another 3 months, by the time we go to January, the real impact of this program will be felt. It will be felt.
So Kericho, we have 1,600 community promoters.
So we wanted to demonstrate then the referral so that then we can now go so that you're able to see that the details that we put here, they are the health facilities. Because we have put it into a primary care network. All the facilities are linked. So as we go through the day, then you'll be able to showcase that. So you have referred your patient?
We had referred earlier on. Now we want to also refer for checkups.
Okay.
Yeah. So we are in tuko kwa Robert's also. Nyumba ya Robert's also ni watatu. We have Mr. Robert and Mrs. Caroline na mtoto. Now for now we are focusing on the child because alikuwa mgonjwa na tukamrefer. Sasa hata tunaweza pima temperature ya mtoto.
Why can you do the vitals so that when you refer, we are able to get them there?
Itafika.
Tutapima tena. Amegia kitu ya temperature.
Ya temperature iko.
Ile ya zamani. Wewe wapi?
Kwani daktari?
Ako mangwan. Digital Your Excellency. Ile tulikuwa tunafanya hivi.
Hiyo ni maswali ya kumuliko.
Hiyo iko very advanced.
Ile ya kumuliko.
Hiyo ni digital slogan. Very advanced. Yeah, hiyo tukisema tupeke huko tumeanza kidogo. Yes.
Tunaanza pole pole.
Pole pole.
Italia hiyo wakati ukifika.
Italia ikifika.
Takujulisha kama sauti haisifika huko.
Asante.
The Mzee is also hypertensive.
Yes.
What do you do also for him?
Nampima.
Okay. Why don't you check how he is today?
Check also his pressure. And then you can also talk to him. Is he on regular medication? Because hypertension, there are things that you can do. Yeah.
This is very good. Let me tell you, this thing is revolutionary. Going to where the people are, check how they are, if there's a problem, you refer them. Because many people get very sick without knowing. Especially these lifestyle diseases that are not painful.
So now even when they know how to go, we find them.
Yes.
Alafu inabidi atake wanaume sana, najua tunakupanga hospitali.
Alafu ujue saa zingine mtu ako na pressure hivi, anaona leo mimi sio mgonjwa, aesi akaenda hospitali. So vile tumefika, unaenda kumencourage aende hospitali.
Waziri, and this is free. No charge.
Everything is free.
Paying for anything. Yes. The national government has done the training. We have bought the kit, and we have a plan on ensuring that, for example, if the strips run out, we are able to refill. We already have a plan on how we are going to do that. Then, even the CHP has some small token of appreciation, a stipend that we have done for matching between the national government and the county government. It's beginning this October.
Public service.
Sasa nimepima SIGNET, pressure yake inaonekana iko juu.
What is the pressure?
The pressure is 178/100.
That is hypertensive. So what do you do?
We refer.
No,
But
you
for now,
ask him first, has he taken medication?
Unakulanga dawa.
Oh,
Kula dawa mzee.
Lakini saa hii vile imeenda. Lakini saa ile imeenda juu hivi.
Because it's a non-hypertensive. Too high.
Especially no.
Amesema. Maisha magumu.
The down one is normally the dangerous one. It's quite high.
This is tolerable.
So wacha wageni wakitoka relax kidogo nirudie nipime. Yeah.
Hii ya mtoto imegoma.
Mara ya mwisho kumeza dawa ni lini?
Sijawahi meza, shida ilitokea hivi basi.
Okay.
Anasema amekuwa na changamoto ya maisha.
The temperature of mtoto ni 36.0, which is normal. Yeah.
Uko sawa kijana?
Yes. The other area, Your Excellency, where they need to be properly cancelled is on the issue of preventive medicine, because the main purpose of this is to prevent people from getting diseases. So some of the things you look at is lifestyles, you look at the environment, how is the environment, where are they getting their drinking water, do they have a toilet, how is all those things.
By the way, Your Excellency, in this kit, we have put water treatment tablets for each community health promoter.
Yes.
So you make sure when you get to a household, you give them the water treatment tablets, tell them how to use the tablets. So that they can clean it.
Hiyo inasaidia sana. Watu hapa kijiji yetu tunatumia maji ya boa. Sasa mtafuta facility kama hii, information imefika huko.
Unasema jambo? Wacha sema.
Wacha sema jambo bila sasa. Kuna hiyo. Shika hii. Na
Acha ingetu.
All right, there you have it, Deputy President Rigathi Gachagua here at one of the households in Cheborgei village. I hope I'm getting the name right. And he has just assessed the situation and how the CHVs, or rather community health volunteers, are working, most especially the kits that they received following the dispatchment by the national government in conjunction with the Ministry of, with the county government. That was on last month, the 25th of August at Uhuru Park, where the national event was held, led by President William Ruto. And today we are having the Deputy President himself visiting this particular area to see what is actually taking place. I understand after this, the Deputy President will be visiting one of the health facilities, that is Cheborgei Health Center. Right, but these are live coverage that will be keeping tabs to you. These as we gear up to the main event that is on Friday, Mashujaa. And the theme of this year is all about matters health, the universal health coverage, most especially under the theme of Afya Nyumbani. And as you can see, this is a true illustration of Afya Nyumbani, whereby these CHVs, or rather the community health volunteers, are making their way to the homes and be able to give health services to residents, most especially at the household level. So we engaged a number of them, and they did manage to engage us and tell us that this is quite important, because even at the household level, they're getting these health services coming to their doorstep. Quite a paradigm shift that we are seeing here at Kericho County, to be specific, also Cheborgei Health Center. We're going to transverse to the other side of this place, that is Cheborgei Health Center, and see what is going to take place. But for now, we cross over to the other side of studio. More will be bringing to you as things continue to unravel here in Kericho County.
From the Kaptatet Stadium here in Kericho County, where the first of 4 days sort of UHC event happening here, just as a precursor towards the Mashujaa Day, where the universal healthcare coverage will be launched on that day by President William Ruto. And just what we expect is that the Ministry of Health is looking towards this event as being a spotlight toward the country's journey in achieving the universal healthcare coverage by establishing, functional primary healthcare networks, and this all aimed at ensuring that there is a cultivated and motivated workforce and skill to as they ensure that healthcare reaches everyone who is even in the grassroots, at the grassroots level. And some of the other objectives that we will see this time is that there will be the establishment of the electronic community health information system, which we have seen a launch just right now by Deputy President Rigathi Gachagua in Cheborge. He has visited the Cheborge Health Facility, and this will ensure that there is a rational distribution of medical supplies and resources. Also, the UHC signifies the promise to equitable access to quality essential healthcare. That is being from maternal healthcare to prenatal healthcare to cancer, some of these lifestyle diseases. All this will be a priority under the universal healthcare coverage, just ensuring that the noble mwananchi, you and I, are covered, and ensuring that this health services reaches even the person that is at the grassroots level. Now, today, the ministry has indicated that this event will underscore their unwavering dedication in ensuring that, everyone gets promotive healthcare, and also the people are sort of cushioned from the costly healthcare system that we have currently in the country. There has been, complaints from Kenyans that, the healthcare system here in Kenya is quite costly. And so we expect that the universal healthcare coverage will play a significant role in ensuring that every Kenyan can access quality healthcare, that is. Also, today's event, from today through to Thursday, will ensure that it places emphasis on the role of primary health care. Now, we have seen that there has been a launch of community health care workers. Now, what these community health care workers do is that they reach out to members of the community. We had a case where in Kirinyaga County, for instance, we see that one community health care worker is deployed to around 100 homes. Now, you see that will ensure that healthcare, we will be able to have records of various ailments that are, probably unique to a certain region. And with those records now, the county government, together with the national government, will be able to plan for some of the health care systems in our devolved units. Also, the ministry has noted that so far there has been a launch of about 100,000 community health promoters and also kits, and a comprehensive assessment of over 14,000 healthcare facilities across the country. Now, this is quite a journey we are starting as a country, and it comes just this event comes just days after the local manufacturing expo and conference that was held at the KICC. We are seeing currently, even here at the Kaptatet grounds, we are seeing a lot of technology around healthcare. Is it the use of drones in delivering, drugs and medical assistance, as well as resources to some of the regions that do not really have access to healthcare? And so the use of technology comes in quite handy, because now we will be having sort of a digitized healthcare system, and this really shows the remarkable capacities that we have as a country in terms of technology as well as healthcare systems, and the provision of a wide range of healthcare products, even as we gear towards having every Kenyan covered under the universal healthcare coverage. Now, the universal healthcare coverage has been on the pipeline, especially since 2015, whereby countries agreed that, under the SDG promoting healthcare services, that by the year at least 2030 there would be universal healthcare coverage for everyone in the world. And so Kenya taking on such a tumultuous task, a tumultuous journey, it shows that there there is a keen reflection on ensuring that everyone to the grassroots level is able to access quality healthcare. Also, last week we saw that the Expo showcased the manufacturing as a key intervention in ensuring affordable access. Now, Kenya will be able to ensure that Kenya will now be manufacturing some of these resources that we will need, and this in the long term will ensure that citizens as well can attain the universal healthcare coverage. Now, just as a reminder that this event is coming just some days before the universal healthcare coverage is launched at the Kericho Green Stadium during the Mashujaa Day celebrations, which will be presided over by President William Ruto. Just about right now, we are having preparations ongoing as we expect Deputy President Rigathi Gachagua to grace this event, and it is a precursor, once again, to the Mashujaa Day celebrations. Now, there is a lot of exhibitions here from various stakeholders in the healthcare sector. We have seen some exhibitions from KEMRI, as well as, some hospitals, as well as even medical students here. And so we now will be linking up with my colleague Linda Alela, who will continue and just probably share some insights on what do we expect as the day goes on. Over to you, Alela.
All right, thank you so much for that comprehensive update as to what to expect the entire week. Sheila Chelagat, she has painted a clear picture of the journey that we have taken as a country in relation to the growth of the health sector and culminating this very important and crucial day. Remember, it's been a conversation that we've had since the time of independence, that of course coming to the heart of it during the Jubilee government, where of course the president then was pushing for the country to ensure that we get universal health coverage across for every other Kenyan, and they have tried to focus on different sectors in the health entities to make sure that they are strengthened so that we all can say we benefit out of this greatness. And so today is another move, and a great one, that is for the Kenya Kwanza government, as they envision of how best they can guarantee us of preventive or promotive aspects of health. Even as we speak about the curative aspect, we should be the last option. And coming to this day, they have done a couple of things and set up different programs that have worked towards getting us into this sport. And so on this very sport, I think I have noble guests this morning. And remember, we are sitting at the Kericho, in Kericho County, that is, on this very ground of Kaptatet. It's very important that you join us as we also get to know what the stakeholders and the players have been doing for us to get this memorable day. We call it the Mashujaa Conference on Health, Universal Health Coverage. And remember, the theme focuses much on how best we can establish the health aspect, good health for that matter, that is universal health coverage at the level of Mashinani. You've seen what Moige has been taking us through, and the progress and the push by the government itself, of course led by the Deputy President there, who is also going to be joining us shortly. But before it gets to that point, allow us to be joined by these two is a lady and a gentleman as we get to these conversations. They've been at the heart of the preparations of these events, and so they'll paint a picture of what they envisioned and of importance, what we certainly expect throughout the session and moving forward. And seated right next to me is none other than Elizabeth Wangia, who is the Director Health Financing Coordinator of the Mashujaa UHC Planning. Thank you so much for creating time to be with us. We also have Dr. Hezron Omolo, who's the Head of Professional Standards and Human Resource for Health. Thank you so much, Dr. for creating time to be with us. And I think our main focus will be painting a picture of the pillars that we focus on this morning and all through. Remember, it's a question of digital, how best we're going to enhance technology for purposes of making sure that we enjoy the best of health. I've seen some drones move, just how best we can as well transport our medicine from point A to point B without these struggles. We're also going to focus on the question of human resource, the question of finance, and most importantly, the primary health care. So thank you so much once again. Begin by introducing yourself and perhaps telling us what really informed this special day.
Thank you so much, and we are delighted. We have been planning for this day for quite some time, close to 2 to 3 months. Close to 2 to 3 months we've been planning for this day, and the main purpose of this day is to showcase to the country and to the whole world on our successes in terms of universal health coverage. Universal health coverage indeed is a journey, it's not a destination. A lot has been done from time behind. We have seen a lot of improvement when it comes to skill delivery. Currently our statistics are at almost 90% of mothers deliver within the health facility. Or when you look at our immunization coverage, it has also gone up to close to over 90% also. Our life expectancy over the past 10 years has also increased. So for us, when we look at universal health coverage, we say that it's a destination, and it's a journey. And what we do is keep building up onto what has been done before. In particular, this time we are focusing on primary health care, because we know that the return on investment when it comes to investing in primary health care has been shown to yield a lot of returns on investment in terms of close to 16 shillings. So and that's why this time we are saying, as we launch this universal health coverage, we want to put our money where it matters, and that's why, as we say, we are focusing on primary healthcare. That's where we are putting our money.
Great, and Kenyans will always ask you, and especially in the question of health, how do I invest? Why should I invest on NHIF? You're not going to get return, for investment, if you'd want to call it that way. And I think that has been a great concern. And so as we try and unpack this, Dr. Ezra, I will loop you in as well to perhaps paint a picture as to why we are here in your own view, even as we get to the nitty-gritty details of the pillars.
Thank you very much for having us. Universal health coverage has been a journey that Kenya has desired to achieve. We had a launch, or rather a pilot of universal health coverage back in 2018. And during then, we focused on what we call the input-based financing. During that time, what that meant was that we provide commodities, we provide the resources, and we expected these pilot counties, which were 4 in number, to offer these services at a cost that is not catastrophic to the general public. During the pilot program, it was entirely free. Now, the 4 counties were identified based on different reasons. One was communicable disease burden, some was because of the road traffic accident, some was also because of the non-communicable disease conditions that were a big burden in those countries. We learned a lot from the pilot program, and those are the lessons that are building up into this. And now, as we start, we are doing output-based financing, meaning that we pay for the services rendered to the public at the cost of the government. So this has been quite a journey, and we are happy as a Ministry of Health and as a government, and of course as a citizen of this nation. You and I know that many families are just a single disease away from poverty. You get renal conditions, you will have to do fundraising, sell a property, and then you will be poor again, despite on which social strata you are in. But with the universal health coverage, people are cushioned from this catastrophic financial expenditure. This model of universal health coverage, we have 4 main pillars. Pillar number 1 is human.
Before we highlight the pillars, and I mean that perhaps would have been my next question as to why these pillars, allow us to listen in briefly as to what the Deputy President is saying as he comes in. I think it's also very important that we are enlightened on that, and then we're going to come back to the conversation.
Walikuwa na Susana kidogo, mambo tu ya nyumbani tumelaishisha. Sio ni mzuri. Sasa gavana na deputy wake walichaguliwa pamoja, walipendana siku ile, tumemwambia vile mlipendana, hii harusi ni ya miaka 5. Mkae mnapendana mpaka mmalize mambo yenu. Lakini mkisikizana hapo mbele, mrudi tena kwa debe mkiwa namna hiyo. Kwa hivyo hii Kericho inaendelea mzuri. Kericho mko sawa sawa? Kwa hivyo sisi tuko hapa na tutakuwa na wageni wengi katika wiki yote mpaka siku ya Friday. Na mumealikwa pale Green Stadium. Mkuje hapo muone mambo ya parade, military parade, muone ile sherehe ya kitaifa ifike hapo mashinani, kwa sababu tulisema tupeleke serikali mashinani. Kwa hivyo mimi nashukuru sana vile mmetukaribisha hapa, na mimi natakia nyinyi mema. Mambo ya majani chai tunaendelea kupambana naye. Tumefanya mabadiliko na imeanza kuleta dalili. Hivi juzi bonus imetoka na si mbaya sana, na tutaendelea ikiendelea namna hiyo. Unajua hii marekebisho hii watu walikuwa wanakataa, lakini wameanza kukubali, na tumeanza kuona mambo inaanza kufanya improvement, na tutasukuma mambo ya maziwa pia tumesukuma. Tunataka mkulima asiende chini ya shilingi 50 kwa lita, isonge kutoka 50 ifike mpaka 60, na hiyo ni mambo ambaye itafanyika na itawezekana. Tumekubaliana watu wetu? Gavana wenu mnamjua? Unajua huyu gavana? Ungetaka aseme jambo? Haya, patia gavana hapo.
Nyumbani pale nizaliwa. Hapa ni Chiburgei, na watu wa Chiburgei, onyesha mkubwa msala. Onyesha yeye umekaribisha sana. Onyesha yeye kage mtu zote kunyogaru angamuga obo shirige. Kogale ina meche Chiburgei reu sige mochi na gengo wa sumo. Au jamono moyo kidogo Kiswahili cha ngetute na Kiingereza kidogo. Gamu bote ni ndio tabu shikiga cheka bwana. Kwa hivyo Your Excellency, this is Cheburge Health Center. It is one of the oldest health centers we have in this region, which is serving this lower part of Bureti. I want to request Your Excellency that in your good grace, you give us or petition for us, we get some 100 million to upgrade the Cheburge Hospital. We intend to do a complex building which have theaters, modern maternity wings, and all that can make these people enjoy the services that we have here. Your Excellency, I want to request with your grace, and I know you are able, umwambie na kumija direct yeye atupee kagari moja kwa hiyo hospitali so that we are able also to serve this people. Na mwisho, Your Excellency, I want to announce here kwa Cheburge, kama sio Rigiji, yeye alisimama na sisi na akasema hii Mashujaa iende Kericho. 90% of why we are holding this Mashujaa is because of your love for the people of Kericho. And we assure you, Your Excellency, tuko na wewe 100%. Na mwisho, Your Excellency, asikia kuna watu ukisema shares wanakuwa na complaint kidogo. Mimi nataka niseme kama governor ya Kericho, leo tuna enjoy hii Mashujaa. To enjoy the benefits that has come along because we voted to the last man in this government. So don't be intimidated by anyone because those who voted must enjoy first. Alafu hao wengine wafuate. Na sisi tunajua equalizer sio mtu akitishwe. Rigiji anasema mzuri. Nataka shares zikuje mingi nyumbani. Nataka maendeleo hapa nyumbani. Wanataka maendeleo hapa nyumbani. Atajipa hivyo na ameka maendeleo. Onyesha kama unataka maneno ya shares, onyesha kama washaongea rais. Tunasema asante sana na tutasimama na wewe, asante sana. Asante sana. Kamione tuko na with your permission, Your Excellency, sijui kama utanipea ruhusa nipee Florence wetu aseme moja. Asante sana.
Asante sana, Your Excellency, the Deputy President of the Republic of Kenya, Rigiji mwenyewe na viongozi wengine ambao wameandamana na Rigiji wetu. Tunasema Rigiji, Deputy President, karibu sana hapa nyumbani. Hapa ni Cheburge, hapa ni Cheboinwat. Tunasema karibu sana. Tunakupenda Rigiji kwa sababu ulisimama na president wetu akiwa Deputy President, ulisimama na yeye ukaombea kura mpaka kawa president wa Kenya. Tunasema asante sana. Tunakuomba Deputy President, hiyo hospitali umeona, tunakuomba upgrade, usaidie ku upgrade iende level nyingine ile watu wamesema, ile governor amesema. Kwa hivyo nakukaribisha, karibu hapa nyumbani, nitakupatia nafasi ukuje ununue shamba hapa. Alafu huyo karibu nyumbani, nitakukaribisha na tuko na wewe, tuko nyuma yako. Hapa wewe ni rafiki yetu wa kufaana na kufaa. Kwa sababu wewe ni mtu wetu, ulisaidia sisi. Kura ya Mlima Kenya yote ilikuja kwa William Samuel Ruto. Tunasema utusaidie sana. Karibu hapa ni nyumbani. Mimi naitwa Francis Terer, kwa jina lingine naitwa Sirinji.
Asante. Mheshimiwa Naibu ya Rais, Mheshimiwa amepeana request ya wewe kununua shamba na kujenga nyumba. Lakini najua wewe uko na watoto wawili. Na hii dunia inabidi tukue kama 5 hivi. Hata pipi tena tutapanga hivi ya heshima hiyo. Kwa hivyo kwa heshima tuko na gavana wetu wa Basho kwa Bomet, wacha gavana wasalamie ndio kwa heshima yote tupewe waziri. Gavana Basho.
Big up Cheburge, ujamge. Your Excellency, Kericho na Bomet ni kitu moja. So hapa ni nyumbani na pia nikichunga na ndugu yangu kama na wa Kericho, ninasema karibu. We are very happy kwa ile heshima ambayo umetupatia leo, tusimame pamoja as we prepare even for Friday. Karibu nyumbani.
Na kama vile gavana ameongea, ukiwa hapa Your Excellency, ukiongea mambo ya shares, it resonates very well na hao watu. Hao watu walitoa kura 100% kwa president na wewe. So sana tukiongea na wewe ni mtu wa kusema ukweli. Lazima pia tukuelezee ukweli. Hao watu wanataka share yao. Anaolelele. Ewosi je wa moti da inga la wona o gebe ke manda wuto bare. Maimane? Ole njine rigiji. Share ana mashia. Ole hii share ana mashia. Omwaba wakati kole share ana mashia. Umesikia Deputy President wamesema wanataka share yao. So ukiongea mambo ya shares hapa umeingiliana na hao watu kabisa, kwa sababu wanakupenda na wanapenda wa president na wako nyuma ya serikali yetu to ensure that we succeed. Karibu nyumbani leo, kesho kutwa, kila siku, kwa sababu hapa ni nyumbani. Shamba pia iko Bomet. Usijali, usipopata nafasi hapa tutakupatia nafasi kule Bomet.
Kwa heshima naibu wa rais, bado tuko na we have supposed to be tarmac road kutoka hapa Kapsegut inaenda kule Kibostuya. Rotich alikuwa amesukuma hiyo CEO wetu wa public service, na I know under your leadership and the president will help us kumaliza hiyo tarmac. Alafu nikimalizia kuna pale kule Tepesonik ina connect mpaka kule Roret na iko na shida. Na naibu wa rais, unajua ule mzee Uhuru alituwest baya sana. Alikuja akatudia hii barabara ya kwenda mpaka Sotik, lakini ukifika hapa Sotik pale tena saa hizi hiyo barabara imeisha yote. Kupaka Sotik ni shida. And this is the main road connecting from Sotik going all the way to Roret, all the way to Sondu. And it's a request that we can also recarpet it. I know during these 5 years, and God willing, we can be able to tarmac with it this time. Your Excellency, kwa heshima yote, nataka nilitarate ndio nipe wasiri ya kwamba sisi tuko katika mjadala ya shares na sisi hapana tishwa. Kama wewe hautaki maneno ya shares, ongea maneno yako. This is our Deputy President, elected by the people of Kenya, and no one can take him on what to say. Hata akiota usiku shares, sisi hapa Kenya tunaamka tunasema yes sir, tuko kwa shares. Sema shares. Shares. Omao. Shares. Lema macho kama mumegi. Pale mama mrengi.
And welcome back to the broadcast. That is the Deputy President of the Republic of Kenya, Honorable Rigathi Gachagua, as well as different county officials head by the governor himself, Kericho County, Honorable Eric Mutai, and of course a couple of people within there just embracing this stride that we are making as a people of Kenya in relation to the question of health. And of course they are at the Kaptatet Mission Hospital. They'll be joining us shortly right here at the Kaptatet Stadium in Kericho County. And back to the lady and gentleman that I have with me. Remember, the conversation is what brought us here. And since they are the main organizers, it's important that as well we get to hear their view. They also enlighten us as to where we are headed. And with me, once again, is Elizabeth Wangia, the Director Health Financing Coordinator of the Mashujaa, that is UHC Planning, as well as Dr. Hezron Omolo, the Head of Professional Standards and Human Resource for Health. Daktari, I know I cut you short as you were getting us to the space of, understanding why the pillars and what about them. But before then, allow me to loop in Elizabeth briefly on the question of the role of the different stakeholders. Today, I see very many stakeholders in the health sector, including the World Health Organization itself, and, these different agencies, their contribution, and above all, the contribution of the common mwananchi, because you realize that the Deputy President has begun by, first of all, going to the people, the health promoters down on ground, because this whole initiative is largely about
So thank you very much. Once again, as a health sector, we acknowledge the role of our partners because we believe that health as an agenda cannot be achieved by just the Ministry of Health. We have various stakeholders. And as a sector, we have what we call a partnership framework. And the partnership framework outlines how we relate with our stakeholders. And our stakeholders range from development partners, multilateral, bilateral. And we also have our implementing partners. We have the private sector. We have the civil society who represent the, the common mwananchi. And we also have the faith-based institutions. So anytime we have any event, and we learned a lot during COVID, and courtesy of our previous partnerships, we managed to coordinate very well and seamlessly even during COVID. And with that, we say that as we celebrate, this is a celebration, we needed to bring the partners on board to also showcase what they are doing and show how they are supporting the health sector. So for us, it's an honor for us to just have all these partners and engage them. They have booths of which they are exhibiting a number of things they are doing. We said we wanted to see a lot of innovations, and anytime you'll walk through the booths, I don't know whether you have tried walking through any of the booths, you actually get an experience. You won't just walk into a booth and just see pamphlets. You'll get an experience, and you'll see what is this that the health sector is doing, whether they are our partners, even our parastatals are here, and they are showcasing what they are doing. Our main theme was around our 4 pillars, as Dr. Hezron indicated, and we have arranged the days according to those pillars. So that
I have to ask just why this particular pillars, because we acknowledge that there are very many other components that are crucial to the success of the health sector and universal health coverage for that matter.
So as for health, we have what we call the system building blocks, and the system building blocks are 8 in number. So we looked at all the system building blocks, and you cannot chew everything at the same time. As much as all the other things are also being addressed in terms like for instance like leadership and governance, things to do with research, they're also within they're also health system building blocks. But we thought that these 4 are the most critical building blocks when it comes to overall service delivery.
Yes. All right, so Dr. Omolo, then we come to these 4 pillars. Perhaps we start by naming them and then getting to understand the aspects and the components within the same pillars. Dr. Omolo.
Thank you very much for having us, and of course for that question. We have 4 main pillars of our UHC in our Kenyan context. And number 1 is the health products and technologies. And if you remember, on 13th and 14th, we were having a local manufacturing expo that was going on at Kenyatta International Conference Center. This was just showing our preparedness in terms of commodity preparedness and, of course, technology-wise to respond to the health challenges of the Kenyan people. The other thing is digital health. Most of the time, or in many cases, we've had all the things, most of the health facility running on analog technology or running on paper. But then we are trying to find out, if you are unwell today, you've done tests here at Kaptatet, and then you've gone to Kenyatta University Teaching and Referral Hospital. Can you be able to access this information without necessarily having to carry all the big files of your treatment history? If today, if you have previous tests that you've done, can we be able to access that history? And even that aside, there is what we call telemedicine. We can be able to have somebody in Kenyatta University Teaching and Referral Hospital walking a doctor in Kaptatet County Hospital, just in a surgery or in managing a case that they will be having at hand. So that is the second pillar, which is the digital health. Now the third pillar, which I'm not going to speak to because the boss and the CEO of that pillar is right here, healthcare financing. So I will keep that aside, but I will come and speak about human resource for health. Now, in human resource for health is actually, of all the pillars, is the only living pillar in that system, without which this will not work. I know healthcare financing will say without finances we cannot work, but sometimes we can also do pro bono. Yeah, but then when you look at human resource for health, even that healthcare financing will need human resource for health to work. So it's one of the very key pillars of our UHC, the Kenyan system. Now, in the human resource for health as a pillar, there are things that we identified and we are working around. One of them is that we needed to improve efficiency when it comes to regulatory of these regulatory bodies. We have 42 cadres, but then we have only 12 regulated cadres. Can we include the unregulated cadres to be also fully regulated? But how then do we ensure also coordination within the already regulated cadres to improve efficiency? For instance, we have Kenya Medical Laboratory and Technicians Board. We have KMPDC. We have Pharmacies and Poisons Board. Do you need to have 12 licenses, for example, to run your facility, or we can have these things centralized and coordination improved to avoid overlaps and improve efficiency in coordinating the regulatory framework. Now, the second thing is that we, for that meeting, we had internal and, of course, meeting with the external stakeholders just to brainstorm and understand how this should work. That happened at Fairview and, of course, at Windsor. Now, we had pre-national dialogue on human resource for health that also happened at Windsor. And in the pre-national dialogue, which is now the three other things that were, other than regulations that were taken care of, is one, workforce production. Number two, labor dynamics. And number three is labor mobility. Now, labor mobility is looking at health workforce production, health workforce migration. And you've seen in the past, we've had foreign doctors coming to work in the country. And we have also have our Kenyan doctors going to work elsewhere. And this is also happening in the area of nursing. We have our nurses going to work in other foreign countries. How do we manage this to make sure that we are first secure before we even export? Because the World Health Organization predicts a global shortage of human resource for health of 10 million by 2030. And 80% of these 10 million are going to be in sub-Saharan Africa, which is where we are. So we are, as we help the global community, we need also to look at how we become human resource for health secure. The second thing is that what is the challenges affecting or bedeviling our health workforce? What are these challenges that makes us be in a have this perennial industrial actions? How can we then improve? That is the labor dynamics. What are the issues? What are the issues when it comes to the work environment, the workload? What is the workload indicator for staffing need, for example? What we call WISN. What is the health labor market analysis? Are we producing what we are consuming, or are we overproducing? Right. So all those things we discussed within the HRH pillar, but also it is going to be discussed here in Kericho on 18th, and you don't want to miss that. It's going to be interesting, and I mean, a very good panelists have been brought on board that will help us dissect and come up with possible solutions for us as a country. And then the last one is the health workforce production. What is the quality of the manpower that we are producing as a country? Right. Are we producing what we are consuming, or are we producing then we are running away to seek elsewhere healthcare from other jurisdictions? But why? And even the ones that are coming, what is the quality of that workforce? How were they trained in those countries that they were trained? If you are trained in our neighboring country, let's say Uganda, how is your curriculum looking like? What is the quality of training? And even within the country, we want to ensure that the quality of training is fit for purpose for delivery of.
Does it not put a question mark on the adaptation of health, community health promoters? Because then many of them will tell you, well, perhaps they have not undergone any form of training, it's out of fashion, and then in the process now is when they get basic training. Does it not put a question mark on that?
Well, it doesn't. You know, if you look at their role as community health workers, most of the time, us as a country, we have had patients being educated to take care of their own. So the basics of it. So if you know how to measure your blood sugar, for example, you have your aunt somewhere who is taking care of their monitoring their blood sugar, and they know when it is high, they are referred. And the same thing is happening with the blood pressure. How many hypertensive patients we have in this country that have blood pressure machine, and they can be able to take it, and when they know it's high, they seek treatment. And these people are helping us to monitor. We have trained them, and because we have trained them to do to take those basic tests, knowing what is the normal level of blood sugar, knowing what is the required BMI, knowing what is the acceptable blood pressure ranges. It helps us in protecting our country. But look at this: many people are working with high blood pressure, but they don't know. But once high blood pressure, if you have, you can get stroke, but it can also damage your nephrons, and then you get kidney failure. And many other conditions would come with that. Right. But you see, this is protecting us from getting to the level that you need ICU care because you're having a stroke, or you are having a heart attack, or you are having kidney failure and you need dialysis every day. Because we identified it on time, they have the gadgets, they are fully kitted, and they can be able to pick this.
Well, that being the latest stride that we have made as a country, and basically also what we have witnessed with the Deputy President doing this morning, I think it is necessary that we constantly, accord ourselves that clarity. We come back to the finance aspect of the pillar, or the pillars. It's very, very important that we understand this.
Yes. So thank you so much. Many times when we talk about financing, everyone thinks of additional resources. But when you look at financing, you are looking not only at wanting additional resources or needing additional resources, but you're also looking at how can you make maximum use of available resources. And with that, we are looking mainly at how can we avoid wastages, because if we efficiently use the available resources, then we may be able to get more health for the money that we have. The other thing that we look at when you're talking about financing is about quality. If financing is not pegged on quality, then to me, that financing is in vain. If my financing doesn't result in a reduction, say, in maternal mortality or, mother's deaths, then I wouldn't say that that even if I'm funding, say, deliveries, that it's sufficient. The money has to actually show that it's producing some quality. Yeah. So in terms of financing, what we have done, and I know it's been all over. We know of the bills that we have been passing, the social health insurance bill, that will ensure that all Kenyans and all residents in people residing in Kenya will have a form of an insurance. The last national health account showed that actually people spend 150 billion on health out of pocket. Yeah. And this is mainly through either harambes or, whichever other means. But we are saying, what if we ensure that all Kenyans have a form of a prepayment, because you will never know when you'll fall sick. You may be well today, tomorrow you are not well. So if everyone has a form of prepayment, when you fall ill, then you are able to be covered. And when you talk of UHC has two aspects. It looks at the service delivery aspect, looking at how much services are you getting in terms of the depth and the breadth of services. And number two thing, when you're talking of UHC, you are looking at equity, the very vulnerable. Are you making intentional that these vulnerable people are covered? Yeah. Then the other aspect of UHC is on financial protection. So if you're not able to ensure financial protection, because we know that when you decide to pay at the point of illness, then clearly you are likely to get into poverty. We have seen that close to 8% of Kenyans actually are at risk of what we call catastrophic health expenditure, where they have to choose, do they need to seek help, whether do they need to seek help or do they need to even get their food? So based on that, the social health insurance bill is quite inclusive. It will cover the three funds. We know we have the primary health care fund that will support the primary health care services. I told you we are, as a government, we are focused on putting the money where it matters. And therefore, we are saying we must have a fund to support this primary health care services. And when you talk of primary health care services, we are also looking at services from dispensaries, health centers, and even at community level. Then when you come to the hospitals, and we are over time, when people have taken charge of their health and they are no longer sick, then we'll see a reduction in the numbers going to seek services in the hospital. Yeah. There has been this notion that as we focus on primary health care, are we ignoring secondary health care, which is curative? I would like to say that we are really not ignoring security, but we are saying we want to focus on financing primary healthcare, because one, we want to have a healthy nation, because we know that human capital is the greatest capital. When you have a healthy nation, it will also be a productive nation. And that's what we want for this country, a productive nation. And if we move away from that and you happen to fall sick, maybe you need a surgery. For example, if you need a cesarean section, no preventive care will prevent you, will help you. You will need the cesarean section. And therefore, we are saying, yes, we'll at that point, we will be covered. Then we are saying, how can we also cater for the catastrophic expenditures? We have seen people going into poverty because of either being in ICU, for instance, or having chronic illnesses. You need dialysis twice a week for life. Maybe you need a renal transplant. It will cost you millions, including the post-transplant therapy. We're saying we need a cover that should cater for that. And therefore, with that, we'll ensure financial protection. And as the commodities are provided and the human resource is also provided, then the service delivery will be adequate. So all these have to work hand in hand, looking at where do we make where are our leakages in terms of financing. Part of our leakages are in terms of, for instance, in the commodities, just medicines are the greatest cost drivers in health, followed by human resource. So if we're able to be efficient in the medicines and the human resource, then when it comes to financing, we will get more health for the money.
Okay.
Yes.
All right, that's incredible. And money is basically everything. We say that this is one docket that receives the hugest chunk in terms of the budgetary allocations. And sometimes we ask ourselves, why is it that it has taken so long for us to get there? How then do we convince the people? How do we engage the people in this stride? Because it is one thing to say that some money will be deducted from people's salary. It's another to actually get those ones that would perhaps, just put their funds, like we have witnessed with NHIF, doing willingly and understanding that this is for their very own good. So how do we involve the people? And perhaps I'd want to understand how the ministry that is functioning in relation to as well, engaging the counties, the various counties. Of course, you would say the primary counties, but then generally the 47 of them.
Thank you. And I don't want to speak for counties, but I know I belong to one. And in those various counties where we come from, every day we are in a WhatsApp group, either for a funeral or we are in a WhatsApp group for fundraising for somebody to access treatments elsewhere.
Yeah.
Or we're in a WhatsApp group trying to, meet those urgent needs. Or maybe we are in a WhatsApp group for, getting to support somebody who suffered some kind of diseases to just get back on the feet.
Yeah.
If we look at the overall cost that then we spend in this 3, 4, 7 WhatsApp group that you are in 1 month, then you see that it is going to be very important for every Kenyan not to be left behind. Because if we leave you behind, then you are the one who will be in need of this fundraising to be able to take care of your own healthcare. So I think we have had discussions, and most of the time when there is a big decision like this, a proper consultation has been done. And it has been done with the counties at the summit. I know there has been engagement between the Ministry of Health and every subnational government. There's also been engagement in public participation for the various bills that we have been having. I think if we know, for instance, that all these things we are doing is for the general good of the Kenyan people, it will be very difficult. It will not be very difficult to convince people.
Okay.
For instance, one of the bills that has given me a lot of happiness is the Facility Improvement Fund. And I'm glad that our honorable members passed the bill. I hope that the president will see it right to assent to it. I don't want to preempt what decision he will be able to make. But you can imagine that the money collected at a facility, a public facility, is used to improve the public facility and to improve the quality of care to compete favorably with the private one. It is the best thing that is happening to this country, because previously you will find a facility collects money and then the county government will use it to put a floodlight, for example, or build a border shed somewhere. I'm not saying that these things are not important, but then this is at an expense, at a cost to the healthcare system. When you collect little revenue and you use it to better the quality of care within those facilities, you can always be assured of one good infrastructure, but also you'll be assured of commodities. So this is the best thing that is happening to Kenya. I can't wait. Thank you.
All right. And you know, you started by saying that people should not miss out on the 4 days, very special days that will definitely be making sure that, you know, we stream this for you to understand what is playing out in Kericho. Remember, today is Kericho, then we'll move to a different county, and the conversation must continue. And we're doing this as well, courtesy of the National Syndemic Disease Control Council, to make sure that this is streamed for you to get to understand what the activities are all about. And so, before coming to this place, we had the Local Health Manufacturers Expo. What about it, and how crucial to, you know, setting precedents to this event?
As I indicated, local manufacturing is one of the key priorities for the sector. And given that a lot of lessons were learned, especially during COVID, we had global shortages because most of our commodities were being sourced from out of the country. Each country decided to hoard their commodities for their people. And for us, we say that if that is the situation, then we need to see how can we empower ourselves to have our own local manufacturing. And in the spirit of East African community, we are not only looking at the market, the Kenyan market, but we are also looking at the East African community market and even beyond. So with local manufacturing, we will not only have our products, but also create employment for our people. Our manufacturers will also pay taxes. Therefore, the money will remain, more or less, the money is rotating within the country. Okay. And we really appreciate the president for actually giving the local manufacturers preferential procurement so that they're able to compete, you know, with other procurements. And we're seeing over time that with such markets, we'll be able to get commodities even at an affordable price. Because part of the ways in which we can save actually on medicines is by use of generic medicines, which many people have this notion that generic medicines are not good enough, but that is one of the key aspects of cost saving when it comes to even financing.
Right.
Yes.
Okay, thank you so much, Elizabeth Mungia, Director Health Financing and Coordinator of the Mashujaa UHC Planning. And I know you are literally itching because, I mean, being an events planner, you certainly are supposed to be moving around. I think I'll be fair enough to allow you to proceed to other activities, even as we await for the chief guest to come in to the stadium as we get to this very important conversation, as well as Dr. Hezron Omolo, the head of Professional Standards and Human Resource for Health. Thank you so much as well for speaking to us this morning. I'm sure it will be a whole week jammed up affair of basically health. And like we said, we're going to move from Kericho County to another county. It's very important that the conversation then continues. I think I will allow you the latitude to proceed and, you know, work on the preparations.
Thank you very
as
much.
we inform you as to what to expect. Thank you once again. And yes, all round, if you would evidently say, it's all about preparation, systems go. We are waiting for that moment where the guest of honor, that is Deputy President of the Republic of Kenya, Honorable Rigathi Gachagua, will join us shortly alongside the governor of this very county, Eric Mutai. We certainly also expect this event to be graced by the CS for Matters of Health, that is Honorable Susan Nahomicha, and equally we'll be having the First Lady of the Republic of Kenya, Mama Rachel Ruto, to grace this crucial, celebration in relation to the question of health. Remember, it's about health to the people down on the ground, the grassroots, how they are involved, how we are involving different stakeholders to make sure that we all together get to that level of preventive care as well as promotive care. But as the specialist will remind you, it is not about rooting out the curative aspect of it. My name is Linda Alela. I have my colleagues as well on standby. We have Joash Onsare, we have Moige on a different beat. We also have Sheila Chilagat, and we'll definitely be doing this Stories for the better part of the week, and certainly updating you also as we await for that grand finale of the event on the Mashujaa Day. So I think at this very point, I'll pay some bill, take a glass of water, and as well, we'll be joining you later on. But for now, I'll leave you with our very own Joash Bisari shortly.
Wewe na familia yako mahali popote wakati wowote, afya yetu ni jukumu letu, sote tuwajibike. Afya inakuja nyumbani, afya ni haki ya wote. Ni leo, ni leo, ni leo, ni leo. Fungueni milango, afya inakuja kwako. Fungueni moyo.
Katika kaunti ya Kericho, kikubwa zaidi tukifanya masuala kuhusiana na afya kwa wote, ni mpango ambao serikali inausukuma ili kuhakikisha Wakenya wote wana afya ambayo ni bora zaidi. Mtazamaji, wanakwetu wananiita Joash Onsare, na moja kwa moja ni mshirikishe ambaye ni naibu mkurugenzi mkuu wa masuala ya afya kutoka Wizara ya Afya, ambaye ni Sultani Matendechero. Karibu sana Sultani Matendechero, na karibu sana katika studio zetu za muda hapa Kaptatet.
Asante sana.
Naelewa fika kwamba hivi sasa mmejiandaa vilivyo kama Wizara ya Afya kuweza kuangazia masuala haya ya afya kwa wote. Labda kwa kifupi, kwa faida ya Mkenya ambaye yuko pale nyumbani, afya kwa wote, mikakati ni ipi kwa sasa?
Kwanza kabisa ningependa kukushukuru kwa kunialika kuweza kuzungumzia jambo hili ambalo lina uzito mkubwa kabisa kwenye mambo ya afya. Na hivi leo jinsi ulivyosema, tumeweza kukusanyika hapa Kaptatet ili tuweze kuanza mikakati ya kuzindua mradi wa afya kwa wote, mpango wa afya kwa wote nchini Kenya. Na uzinduzi huu ni kitu ambacho ni cha muhimu sana, kwa sababu si nchi nyingi sana ulimwenguni ambazo zimeweza kujipiga kifua mbele na kusema kwamba tunataka kutekeleza ama kufanya mambo ya afya kwa wote. Kwa hivyo sisi kama nchi tumekuwa na haja ya kuweza kufanya haya mambo, kuweza kuimplement mambo ya afya kwa wote kwa muda. Si sasa ndio tunaanza. Tumeanza hapo mbeleni, hatukuweza kama mara mbili. Na sasa wakati huu tumeweza kupata suluhisho, kwa sababu wakati wa kwanza tulikuwa tunashughulikia sana kutoa matibabu kwa wale ambao tayari wamekuwa wagonjwa. Sasa tulikuwa tunaelekeza mambo yetu mengi sana kwenye mambo ya matibabu. Lakini hivi sasa tumeweza sasa kupata ile formula ambayo tulikuwa hatuna wakati huo, na tunasema sasa tunaangalia sana mambo ya kuboresha afya, mambo ya health promotion, na kuweza kuzuia magonjwa, disease prevention. Sasa hapo ndio mahali ambapo tunatilia mkazo kabisa, ili tuweze kupunguza idadi ya Wakenya ambao wanakuwa wagonjwa, alafu pia tunapunguza idadi ya Wakenya ambao sasa wanafika hospitalini kupata matibabu, na tunaweza sasa kushughulikia sana mambo katika jamii ili kuweza kuongea nao, waweze kuzuia magonjwa na waweze kuboresha afya.
Bwana DG, kuna hili swala ambalo linazungumziwa kwa sasa, ni mjadala. Kuna hili swala la kinga kabla ya tiba. Naelewa fika kwamba hivi sasa tukizungumzia mpango wa afya kwa wote, swala la kinga linajitokeza pale. Labda kama wizara, hiyo mikakati ya kinga kabla ya tiba iko vipi? Na pia kuna wale Wakenya wangependa kujua, hawa maafisa wa afya nyanjani, mafunzo yao yamefikia kiwango kipi?
Sasa hapo ndio mahali ambapo tunaleta hii filosofia ya primary healthcare. Nafikiri umesikia primary healthcare. Sasa wale maafisa wa afya nyanjani ambao tunawaita community health promoters.
Ndiyo.
Tumeweza recruit zaidi ya 100,000.
Ndiyo.
Ambao sasa watakuwa wanapatikana nchini kote. Kila mmoja atakuwa anashughulikia takriban watu 500. Sasa ukiangalia idadi ya Wakenya ni milioni 50. Kwa hivyo kama tuna maafisa wa afya nyanjani 100,000, basi kila mmoja kwa average anaweza kushughulikia kama watu 500 kwenye jamii.
Ndiyo.
Hiyo ni kama households kama 100.
Ndiyo.
Sasa hawa watakuwa wanaenda nyumbani, tumewapatia kits. Utaona kuna mizigo ambao tumewapatia.
Ndiyo.
Pale ndani kuna mashine ya kupima shinikizo la damu.
Ndiyo.
Kuna mashine ya kupima kisukari.
Hata uzani nilio.
Kuna mashine ya kupima uzani.
Ndiyo.
Kwa hivyo watu ambao wako manyumbani ambao labda wameanza kukua na hali ya kuwa wagonjwa ama wana ile danger, wana hatari ya kuwa wagonjwa, wanapatikana kabla hawajakuwa wagonjwa ama kabla hawajakuwa wagonjwa zaidi.
Ndiyo.
Alafu sasa hawa maafisa wa afya nyanjani wanaweza sasa kuwafanyia ile referral kwenda kwenye hospitali ya karibu.
Ndiyo.
Kuna kitu ambacho tunatengeneza kinaitwa primary healthcare networks.
Ndiyo.
Sasa hospitali zote kwenye eneo zinaweza kuwekewa network ambapo utapata kama ni hospitali za kibinafsi, hospitali za umma, hospitali za mambo ya kama zile religious, faith based hospitals. Zote zitajumuishwa kwenye hii primary care network. Sasa utapata kwamba huyu afisa wa afya nyanjani anajua ile hospitali ambayo iko karibu kabisa ambayo itashughulikia, kwa sababu hospitali zina uwezo wa kushughulikia mambo tofauti. Kwa hivyo anapofika pale nyumbani anapata kwamba kuna mtu ambaye ana shida fulani ama ana hatari ya kuwa na ugonjwa fulani. Anajua ni wapi haswa ambapo huyu atapata
tiba.
Na hawa maafisa wa afya nyanjani ndio watakuwa wanaendesha mambo ya kuboresha afya, kuweza kufanya health promotion kwenye jamii. Kwa hivyo utapata kwamba hii ndio ile missing link ambayo haijakuweko kwa muda. Na tumejaribu kuwaleta hawa maafisa tukiwaita community health volunteers, yani wa kujitolea, na haikuwezekana kwa sababu hawangeweza kujimudu. Lakini hivi sasa serikali ya kitaifa ikishirikiana na serikali za kaunti wanatoa pesa kiwango fulani kila mwezi.
Ndiyo.
Serikali ya kitaifa inatoa nusu, serikali ya kaunti inatoa nusu. Ili hawa maafisa wa afya nyanjani waweze kujimudu na waendelee na kazi zao bila kukuwa na shida yoyote.
Ndiyo, shikilia hapo Bwana Matendechero. Mtazamaji, ni shughuli nzima ambayo tunazidi kukupeperushia moja kwa moja kutoka uwanja huu wa Kaptatet hapa katika kaunti ya Kericho, ikizingatiwa kwamba sherehe za Mashujaa zitakuwa zinafanyika kutoka uwanja wa Green Stadium ambao huko katikati mwa jiji la Kericho. Ambapo tutakuwa tunazungumzia swala hilo kwa kina zaidi, na vile mtazamaji, tukiangazia mpango wa afya kwa wote. Ni mpango ambao umekwepo. Kumbuke kwamba tarehe 25 mwezi uliopita, ama ukipenda mwezi wa Septemba, Rais William Ruto pamoja na viongozi wakuu serikalini kutoka wizara mbalimbali, wizara ya afya ikiwemo ambayo inaongozwa na Waziri Susan Nakhumicha, waliweza kuzindua vifaa ambavyo vitawafaa wale ambao ni maafisa wa afya nyanjani katika kuendeleza ile afya ya msingi katika jamii na kuweza kuhakikisha afya iko nyumbani katika ile hashtag afya nyumbani. Mtazamaji, ndo shughuli nzima ambayo tunazidi kukupeperushia hivi sasa katika uwanja huu wa Kaptatet. Tunasubiri tu mgeni wa heshima ambaye ni naibu wa rais Rigathi Gachagua akiandamana na waziri wa afya Susan Nakhumicha kuweza kufika hapa ili kuweza kuzindua ili swala la afya ama mpango wa afya kwa wote, kikubwa kuhamasisha wanajamii kuhusiana na mpango huu, kwa sababu kulingana na wale wataalam na wadadisi wa masuala ya afya wanasema kwamba ni mpango ambao unapania kuweza kusaidia na kuziba mwanya wa masuala ya afya ili kusiwe na tiba kila wakati, lakini muhimu kukuwe na kinga. Hapa katika studio zetu za muda katika uwanja huu wa Kaptatet niko naye Sultani Matendechero ambaye ni naibu mkurugenzi mkuu katika wizara ya afya. Na bwana Matendechero, ndio tumezungumzia hili hivi sasa, tunawasubiri wale wageni wa heshima. Hivi sasa naibu wa rais Rigathi Gachagua wametembea katika vituo vya afya mbalimbali, wameenda pale Cheborgei kama nimelipata sawasawa, na vilevile wameenda Kaptatet Hospital na sasa tunamtarajia hapa. Ni jambo lipi ambalo tunatarajia litangazwe siku ya leo na naibu wa rais na waziri wa afya kuhusiana na mpango wa afya kwa wote?
Kwa kweli hii leo tunaanza kama ni kufanya ile build up. Kama tunaanza tamasha ambazo kilele chake
ni Ijumaa.
Kitakuwa Ijumaa wakati rais mwenyewe wa Jamhuri ya Kenya Mheshimiwa William Samoei Ruto ataweza kukuja hapa Kericho wakati tutakuwa tunaadhimisha siku ya Mashujaa. Na atazindua mradi huu mpango huu wa afya kwa wote sasa kirasmi. Kwa hivyo hizi siku zote kuanzia leo hata kesho tutakuwa bado tuko hapa. Ikifika siku ya Jumatano tutakuwa hapa bado. Ikifika Ijumaa tutakuwa hapa. Kwa hivyo leo naibu rais anakuja na tutaweza kuzungumzia mambo tofauti. Ameweza kuenda kwenye nyumba kuona jinsi hawa maafisa wa afya nyanjani wanavyofanya kazi. Alafu hawa maafisa kuna hii kama simu ambayo wamepewa smart ambayo imewekwa mambo fulani ambayo wakiangalia pale nyumbani wanaingiza. Kwa hivyo tutakuwa na information system
afya digitali.
Digitali sasa. Sasa mambo yamekuwa digitali sasa. Anaingiza pale kwenye simu, inatumwa kwenye dashboard. Alafu kwenye hii hospitali ambayo nilikuwa nakwambia watakuwa wanaelekeza wagonjwa. Sasa kuna ile dashboard ya ile community health unit. Sasa naibu rais aliweza kufika pale pia akaweza kuangalia hiyo hospitali ya pale karibu. Na ikiwa kwamba huyu wananchi ambaye anahitaji matibabu labda anafaa aelekezwe kwenye hospitali ambayo ina huduma ya juu zaidi. Kama vile sasa anahitaji mambo ya ICU, intensive care unit, huduma ya dharura na vitu kama hivyo, basi kuna tena njia ambayo kuna vile hii hospitali ndogo inaweza tena kumuelekeza. Kwa hivyo naibu rais akatoka pale Cheporge akaenda Kaptatet Sub County Hospital ambayo kwenye hii primary health care network ndio sasa ile tunaita hub. Yani sasa hospitali ambayo inashughulikia hizi hospitali zingine ndogo hapa ndani zote zimeunganishwa pamoja kwenye network ili ziweze kutoa huduma ambayo inafaa. Kwa hivyo amekuwa kule na bado kuna hii habari ambayo inatoka kwenye nyumba, kuna vile inakuja mpaka inaonekania pale kwenye hospitali ya Kaptatet. Kwa hivyo naibu rais alikuwa anaangalia mambo ya smart primary health care networks, jinsi zinavyofanya kazi, na hizi networks zitakuwa kote nchini ambazo zitaweza kurahisisha mambo ya kuwatibu wananchi. Alafu atakuja hapa sasa, kilele cha leo itakuwa sasa ni hizi tamasha ambazo tunasubiri hapa za kuweza kuzindua zile smart primary health care networks.
Bwana Matendechero, umezungumzia swala la system, kwa sababu ukizungumzia mambo ya system kuna ule utaratibu ambao unafuatwa, maafisa wa afya nyanjani alafu waelekee katika kituo cha afya cha kaunti ndogo, na hivi sasa ndio tunaelewa fika kuna mikakati ambayo wizara imeweka. Bila kusahau kuna zile hazina 3 ambazo hivi sasa serikali inapania kuweza kuwepo ili kufadhili afya. Labda tukiangalia kwa mfano afya msingi, ile afya katika jamii, kuna zile zahanati ziko pale nyumbani, labda masuala ya mambo ya miundo msingi iko vipi?
Sasa hayo mambo yanashughulikiwa yote, na ningependa kuambia kwamba wakati huu, si nilikwambia kwamba tumejaribu hapo awali tukashindwa
mara 2.
Sasa wakati huu tumejifunza kutoka kwa
yale mapungufu,
zile experiences ambazo tulikuwa nazo wakati huo. Sasa tunatatua hayo maneno. Kuna sheria ambazo tunatarajia kwamba tutaweza kuzitunga kama inawezekana hata kabla ya siku ya Mashujaa, ili isiwe kwamba tunafanya tu vitu ambavyo havina msingi kwa sheria. Hizi sheria zitaweza kuonyesha jinsi pesa zinazokusanywa zitaweza kutumika kuhakikisha kwamba tuna ile miundo msingi ambayo unasema. Na sio tu kwa muda mfupi, tunasema kwamba tunataka kuwa na sustainable infrastructure kwenye facilities zetu. Kwa hivyo kuna mpango maalum kabisa ambao umewekwa kwenye hizi sheria ambao ukifuatwa tutahakikisha kwamba kila wakati mtu yeyote ambaye anaweza kuelekezwa kutoka kwenye jamii kukuja kwenye hospitali anapata zile huduma ambazo anahitaji.
Ndio.
Kuna kitu ambacho ulikuwa umegusia.
Ndio.
Mambo ya ile system.
Ndio.
Utapata kwamba nilikuwa nimekuambia kila mhudumu wa afya nyanjani mmoja anashughulikia takriban watu
500.
Na si 500 kamili, inalingana kwa wapi. Kuna mahali pengine utapata anashughulikia watu wachache, kwingine mahali watu ni wengi utapata ni wengi. Lakini hiyo ni average. Na sasa utapata kwamba hawa wahudumu wa afya nyanjani kama kati ya 10 na 20, inategemea ni wapi, watakuwa pia wanashughulikiwa na mhudumu wa afya ambaye anaitwa community health assistant. Community health assistant anashughulikia sasa hawa kati ya 10 na 20, inategemea pia wako wapi. Kwa hivyo hii sasa inaleta hawa watu ambao wako kwa nyumba wameshakuja, wamefika kwa mhudumu wa afya kwenye hospitali. Haya, sasa hizi hospitali zote ambazo ziko kwenye eneo la sub county zinatengeneza ile primary healthcare network. Na huyu community health assistant ambaye sasa ndiye anashughulikia hawa wahudumu wa afya wa nyanjani anasimamia community health unit ambayo ina watu karibu 10,000. Unaona? Takriban. Kwa hivyo kila mtu anapatikana kwenye hii system, na hakuna mtu ambaye atakuwa anahitaji huduma za afya ambaye atakosekana, kwa sababu imepangwa kwa njia ambayo lazima kila mtu anafikiwa, na yule ambaye anahitaji matibabu ataweza kuunganishwa na hospitali ambayo itatoa hiyo matibabu.
Ndio. Tuangazie ili swala la hamasisho. Naelewa fika Wakenya wengi hivi sasa wamefungulia runinga, wanataka kujua hamasisho litawafikia vipi. Labda mikakati ya hamasisho iko vipi kutoka kwa Wizara ya Afya ili fikie yule Mkenya ambaye yuko mashinani?
Sasa tunapanga mambo ya communication advocacy, tunaipanga kwenye sehemu 3. Kuna ile ambayo inaendelea tayari ya kuhakikisha kwamba wale watu ambao wanatengeneza sera, policy makers kama sisi na wengineo pia wamehamasishwa kabisa, wameelewa kwamba hii ni kitu muhimu na inatakana wafanye upande wao. Alafu kuna ile implementers. Sasa wale ambao wako mahospitalini wenzetu ambao wanatibu pia wanahamasishwa, wanaambiwa nyinyi ambao mnatoa huduma, wakati tunatoa huduma kwa wote, sasa mambo yanabadilika, hivi ndio itakuwa inafanyika. Kuna wale ambao wanatoka kwenye mashirika yasiyo ya kiserikali ambao wanasaidiana sana na wahudumu wetu wa afya, pia hao wenye hiyo level ya implementers. Alafu kuna sasa wale watu ambao ni users wa service ambao ni jamii, the community. Community sasa ndio hata sasa kama saa hizi tuna mpango ambao sasa tutafanya kazi na watu ambao wanatoka kwenye vyombo vya habari. Tutaweza kuelimisha watu kwa masehemu mbalimbali. Tutaweza kukuwa na mikutano ya hadhara ili kila mtu kwenye jamii aweze kufikiwa na apate ujumbe ambao wanatakana kwa.
Hivi sasa najua kuna masuala tunazungumzia hivi sasa, utayari wa mvua ya El Nino ndo kaunti zinafanya kwa sana. Hivyo tufanye vipi ili kuhakikisha au maafisa wanatoa huduma bora?
Sasa mipango ya El Nino imeweza kufanywa na hivi sasa tumejiandaa kabisa. Ikiwa mvua ya El Nino itanyesha, basi itatupata kama tuko tayari. Tayari kuna zile messages ambazo zimeanza kwenda nje, hata watu tayari wameanza kuzipata jinsi wanavyotakikana kujikinga na madhara ya El Nino. Wameshaambiwa ni madhara yepi, kama kuna tuseme viwango vya madhara wameweza kuambiwa. Na pia tunaweza kutoa habari kama kuna shida watapata wapi usaidizi.
Asante sana Bwana Sultani Matendejere, naibu mkurugenzi mkuu wa masuala ya afya. Mtazamaji, hivi sasa tutakuwa tunazungumzia swala hili kwa kina zaidi na mgeni wa heshima, naibu wa rais Rigathi Gachagua. Hivi sasa atakuwa anaingia katika uwanja huu wa Kaptatet, shughuli nzima ikizidi kufanyika kikubwa, tukimsubiri na vilevile tukimsubiri waziri wa masuala masuala ya afya ambaye ni Susan Nahumicha, ili tuweze kujua ni kipi ambacho kinajiri siku ya leo. Kikubwa tukiangazia masuala ya afya kwa wote. Ni mpango ambao serikali imekuwa ikiufanikisha ili kuweza kufanikisha swala hili nzima la mpango wa afya kwa wote. Mtazamaji, ni shughuli nzima ambayo tunakupeperushia mubashara kutoka uwanja wa Kaptatet katika kaunti ya Kericho, ikizingatiwa kwamba sherehe kuu itakuwa inafanyika siku ya Ijumaa, wakati ambapo Rais William Ruto atakuwa anazindua mpango wa afya kwa wote, hii ikiwa ni awamu ya 3 ambayo imekuwa ikiendelezwa humu nchini. Awamu za kwanza 2 ziliweza kufanyiwa majaribio na wale wadau kutoka Wizara ya Afya, wakisema kwamba hayo matayarisho ambayo yamekuepo mara 2 ni tosha kuweza kufanikisha awamu ya 3 ya mpango wa afya. Shughuli nzima ambayo inafanyika katika uwanja huu wa Kaptatet katika kaunti hii ya Kericho. Na mtazamaji, shughuli hii tunaizidisha hapa nikiwa na kikosi kizima, ambapo tumepiga kambi katika kaunti ya Kericho kuanzia hapo jana. Tutaweza kukipiga mpaka siku ya Ijumaa, wakati wa kilele cha sherehe za Mashujaa, sherehe za 60 sherehe ambazo kikubwa tunaangazia shughuli nzima ya mpango wa afya kwa wote. Na moja kwa moja nimshirikishe pia mwenzangu ambaye ananena kwa sana katika lugha ya Kiingereza, Linda Alela. Uko vipi Linda?
Salama, nashukuru. Nafurahia. Wajua siku zote wanasema kwamba afya kitu cha maana sana. Kwa kimombo tunasema health is wealth.
Na labda Linda, nikukatize kidogo. Hapa tuko katika kaunti ya Kericho. Najua mandhari hapa kuna kabaridi kanakuja. Sijui ni El Nino, watadisi watatuambia.
Wajua. Tusije tukaanza kusema tukauliza wale watabiri wa hali ya hewa ilikuwaje. Najua Wakenya wengi wanauliza hilo, lakini kwa sababu hapa tunaletwa na masuala ya afya, nafikiri ni afya ambayo tutazungumzia. Na hapo awali nilikuwa nakuambia kwamba kwa kimombo tunasema health is wealth. Kitu cha maana sana. Wakati mwingine ukiwa na afya nzuri huwezi ukaelewa kwamba hapo mbele kunaweza kukawa na tatizo. Na wanasema kwamba unafunga macho unafungua hivi wewe ni mgonjwa. Kwa hiyo ukiwa na hakikisho ya kwamba tuna uwezo kama nchi au tuna uwezo kama county kuhakikisha kwamba kila wakati mtu ni mgonjwa, hilo linashughulikiwa kwa haraka, na labda watu wasiwe na wasiwasi kuhusiana na masuala ya afya na magonjwa. Nafikiri ni kitu cha maana. Tutachapa kazi.
Maendeleo yatajitokeza.
Wajua sisi tunaambiwa kama wanahabari hauwezi ukawa mgonjwa. Haitakiwi uwe mgonjwa kama haitakikani uwe mgonjwa kama mwanahabari, sababu unatakana uje uambie watu maneno jinsi mambo yanavyokuendelea. Huwezi ukapoteza sauti yako. Kwa hiyo aspect ambayo wanazungumzia, what we're talking about, preventive healthcare is something that is very, very important. And that's basically what we are running to make sure that we ensure we achieve this as a nation. Preventive, promotive. Kabla hatujazungumzia masuala ya hapo basi unakwenda kwa daktari kupata dawa, kupata matibabu. Tumeshatatua hapo chini. Nafikiri hilo ni jambo la maana sana, na tutashukuru serikali iliyokuwa ya Jubilee kwa sababu ndio mwanzo walianza mambo haya, ikiwemo na rais ambaye alikuwa ni naibu wa rais wakati huo. Na ni jambo la maana sana kuona kwamba kama rais wa Kenya ameamua kwamba hili swala la afya lazima lisukumwe, na wanaangalia kama Kenya Kwanza au kama government ya Kenya Kwanza wanasema basi ni bora tuangalie ni mambo mengi ambayo labda hayakufanywa katika serikali ya Jubilee, na ni nini ambayo tunaweza tukafanya wakati huu ambao ni tofauti. Something that will actually guarantee us that we're going to get universal health coverage, and not just lip service, not just the policies, but definitely implemented to the later. So yes, I think we are at this very point where we're about to kick off this very important celebration, that is the Mashujaa celebration, and that is the conference of the universal health coverage. I see the Deputy President, kama ulivyosema hapo awali, is in the house already, and so shortly we will kickstart this. I am looking forward to listen to what it is that the government has in store. Unajua wakati mwingine lazima wazungumze, ndio tuwasikize, ndio tujue wana mipango gani, na sisi tuambie wananchi. Kweli kabisa. Muhimu sana, usije ukaambiwa tu kitu alafu wewe unakubali.
Ndio Linda, ndo shughuli nzima pia. Alafu nimekuwa nikipita kabla niweze kuwa na mahojiano na ambaye ni naibu mkurugenzi mkuu wa afya katika Wizara ya Afya ambaye ni Sultani Matendechero. Ameweza kuzungumzia swala la afya dijitali. Amesema kwamba kuna vile vifaa ambavyo wale maafisa wa nyanjani wako navyo, wanaweza kuchukua data ya mgonjwa wakaiweka kwenye kifaa kile ambacho kinakaa kama simu, alafu taarifa hiyo inapelekwa katika kaunti ndogo, ile hospitali ya kaunti ndogo, zile level 4 hospitals, na unapata kwamba zimeweza kusaidia ili kuweza kufanikisha, na tumeona naibu wa rais Rigathi Gachagua akiandamana na waziri wa masuala ya afya Susan Nakhumicha wakipita pale Cheborgei, wakaenda katika ile zahanati ndogo,
na pia wakaenda kwenye nyumba fulani
hapo, wakaweza
kukutana watu na wakathibitisha. Nafikiri hiyo ilikuwa ni thibitisho kuu, kwa sababu pia ni vizuri ukiangalia hivi vitu vinafanyika vipi, you know, the practical aspect of things, and I think we have gotten to witness that. So it's a sure way to trust that Kenyans, you know, are on the right track in terms of getting the health coverage aspect right.
Na Linda, naona ndo mkoko unaalika, ukiangalia wale maafisa wa itifaki wanakimbia kweli kweli, na ishara tosha waziri wa afya anafika, na wakati wote mtazamaji, hizo picha ambazo anazipata moja kwa moja ndo maandalizi ya kuwakaribisha wale wageni wa heshima, naibu wa rais Rigathi Gachagua na
lazima kuna CS ambaye ni waziri wa
afya,
ndio nyumba yake na kama unavyoona ni kama anafanya jambo la busara sana. Kwa hiyo tusimsherekee kwa sasa, wacha tuone mengi ambayo ametuandalia, matokeo muhimu sana. Kwa hiyo sasa Nakhumicha yupo tayari, anampokelea naibu wa rais,
anampokea naibu wa rais, ndio yule ashafika. Na mtazamaji, picha hizi ndo za moja kwa moja tukiendelea kupata shughuli nzima, na tutakuwa tunarusha moja kwa moja ili tuweze kujua ni kipi kinajiri, kwa sababu wale maafisa wa itifaki washafika pia.
Na unajua kwa sababu ni wanasiasa, sijui kama umewatazama hapo awali wakizungumzia masuala ya kisiasa, wakisema kwamba maneno ya shares hapa na pale, gavana wa kaunti hii ambaye ni Eric Kimutai pia akizungumzia hilo. Najua kama wanasiasa kwa kawaida maneno ya siasa hayawezi kosa,
lakini kikubwa tutakuwa tunatupia jicho kuangalia masuala ya afya kwa kina, ili kuweza kujua huu mpango wa afya kwa wote uko vipi, na labda ni kipi Mkenya anafaa kukijua.
Nafikiri unamfahamu pia Lumumba na wengine wengi wanasema kwamba katika kitabu chake anaandika ya kwamba health, anasema health is very important, but also anakubaliana ya kwamba politics is the bloodline of every activity of a nation. Kwa hiyo unapoona wanasiasa wanachukua mkondo huu wa kuhakikisha kwamba tunapata masuala ya afya jinsi yanavyotakikana, basi unaelewa kwamba ni wanasiasa ndio viongozi wetu kabisa. Kwa hiyo lazima tuwasikize na tuhakikisha ya kwamba tunapowasikiza nao wametekeleza yale ambayo wametuhakikishia wana uwezo wa kutekeleza.
Sio wanahabari, unajua letu ni kufuatilia na kuhakikisha wanalitekeleza wanalolisema.
Umemwona Mwege William alipokuwa akimfuata naibu wa rais tokea walipotoka kule mpaka hapa
kabisa, kwa sababu anataka kujua hiki kinachozungumziwa kina manufaa yepi kwa Mkenya,
na tunapopeperusha una uhakika ya kwamba ni kitu ambacho kinafaa kupeperushwa. Tumetathmini, tumeangalia, tukasema ni kitu ambacho kinafaa, tusije tukakwambia kitu ambacho hakipo. Kwa hiyo kama unavyoona, nafikiri ndio mambo sasa. Kwa hiyo muda wote tutakuwa tunaanza mazungumzo haya, tutakuwa tunaanza sherehe hizi moja kwa moja, na kama ulivyosema, itakuwa letu ni kuwaambia tu ni nini ambacho kinaendelea, sio?
Alafu pia usisahau, tutakuwa tunalidadavua kwa kina ili kuweza kujua ni kipi ambacho tunakitarajia.
Umesema huu ni wakati wa mchana, kwa kawaida tunazungumza masuala ambayo tunazungumza kwa lugha ya Kiswahili. Kwa hiyo sina budi, au vipi?
Hauna budi.
Sina budi utendwa.
Inabidi tu. Na mtazamaji, ndo shughuli nzima nikiwa na mwenzangu hapa Linda Alela, tunazidi kukupeperushia matangazo moja kwa moja kutoka uwanja huu wa Kaptatet. Naibu wa rais Rigathi Gachagua ashafika hapa, waziri wa masuala ya afya Susan Nakhumicha ashafika, na wadau wengine wengi
wanasema kwamba tutamtegemea pia mama wa taifa, labda Rachel Ruto atakuwepo hapo baadaye. Hilo pia tutawaambia kama ndio hivyo, au unajua pia nao wageni waheshimiwa wakati mwingine unaweza kusikia kitu kimefanyika sehemu nyingine, kwa hivyo hauna uwezo wa kufika, lakini ombi letu ni kwamba atafika, kwa sababu pia tumemwona katika kipaumbele kuzungumzia masuala ya afya, na ni jambo ambalo ni la muhimu sana wakati ambapo tunaangalia viongozi wetu na kila mmoja anajikakamua kuwa katika hali ya hii mazungumzo. Unajua ni kitu cha maana sana. Kwa hiyo lisiwe ni jambo ambalo linawachia viongozi tu, liwachiwe all stakeholders of the health sector. It's important that they are involved. You know, when we're talking about the key pillars that the stakeholders told us earlier on, so the question of finance, very, very important. So the question of digitization and the aspect of innovation, that is very, very important. The question of human resource, very, very important. It's largely about primary health care, preventive, promotive health care. These are the conversations that we're having for the better part of the week. Kwa hiyo kuanzia leo mpaka ni umesema ya Alhamisi, Ijumaa ndio kilele kwa sababu ya Mashujaa. Hapo tutakuwa tunasherehekea, lakini pasipo kufika wakati huo au kabla ya kufika wakati huo, we will be about the pillars, and I think we'll be here to make sure that you are enlightened on this. Remember, it's very important that the people then are involved and they understand. And so I think it's upon them to take time to listen to what it is that will be, showcasing and streaming live for you, for them to get to understand. Wanauliza tutaambiwa tutoe zaidi wakati ambapo wanazungumzia social health. Watu wanauliza NHIF ilitufanyia nini? Sasa kwa nini social health zitatufaa kweli inavyofaa? Wewe unahisi vipi?
Linda, kuna masuala mengi ambayo yamezungumziwa na wadau katika masuala ya afya, na mtazamaji, kwa faida yako tumeweza kudadavua haya kwa kina katika taarifa zetu, na vile vile kikosi chetu kizima kimekuepo nyanjani kuhakikisha tunakupakulia taarifa hizo zote. Na mtazamaji, sherehe hizi zikifanyika katika uwanja huu, tutakuwa tunasubiri shughuli nzima kuweza kufanyika moja kwa moja kutoka katika kaunti ya Kericho, tukitumia uga wa Green Stadium ambao huko katikati mwa mji wa Kericho, na vile vile tutakuwa tunaangazia mengi, tukusikia wadau wanasemaje kuhusiana na shughuli nzima ya mpango wa afya kwa wote. Ikumbukwe kwamba tarehe 25 mwezi uliopita, Rais William Ruto pamoja na maafisa serikalini waliweza kufika na kuweza kuzindua vifaa vya maafisa wa afya nyanjani, ambapo tuliweza kuzungumzia hilo. Na Linda, uliweza kuona kwamba vile vifaa ambavyo viliweza kutolewa kwa maafisa wa afya nyanjani, mimi niliona kwenye studio, niliona kifaa, kuna kile kifaa cha kupima uzani. Kumaanisha uzani lazima
muhimu sana, na unajua siku zote unaambiwa ni vizuri kufanya exercise, ndio? Kwa sababu every time you're reminded how important exercise is, so that means, well, there's nothing wrong with you growing big, but at the same time it's good to just be sure of your weight, because then out of weight you find that there are very many health conditions that will come out of it. So it's very important that then you understand all these nitty-gritty details, and that's actually what they're referring to as primary health care. So as they have also said, we need not to worry about the coming in of the community health promoters, because then they're coming in with the basic information about health. Wao si wataalam, lakini wanakukumbusha kwa pale nyumbani, Josh Onsari, tunajua kwamba wewe sio daktari, lakini ni vizuri kujua ni jinsi gani unaweza ukajipima uzani, ni jinsi gani unaweza ukapima temperature kwa Kiswahili mtaiita vipi? Kupima joto, vya joto, sio very very important, because these are the basic things that you actually get even before you get to see the doctor. They try and you get there, and then you definitely get to weigh yourself on the machine and understand, okay, at this point then the doctor is capable of examining you, having understood all these primary aspects of your health system. So it's very crucial that they have this. And now that you've spoken about that, it reminds me of as well the event that the Ministry of Health also had over the weekend, say on Friday and to Saturday, in relation to involving the local manufacturers. Unajua kuna wale watu ambao wana uwezo wa kutengeza dawa hapa nchini. Kwa hiyo kabla hatujakimbia nchi za nje kwenda kutafuta dawa, tujitegemee kwanza na tuhakikishe kwamba hawa watu wamepatiwa kipaumbele, kwa sababu ni kitu kimoja kujitegemea, ni kitu kingine kuhakikisha kwamba tunaangalia hao ambao wana kujidhibiti na wanahakikisha kujitayarisha, basi nao wamepatiwa nafasi, kwa sababu usipompatia nafasi basi utasema vipi utajitegemea, inakuwa ni vigumu.
Itakuwa vigumu.
Na kwa sababu tuna uwezo, nafikiri wamefanya jambo la busara sana to make sure that they push and advocate for this aspect of embracing local manufacturing.
Ndio Linda, shukrani sana kwa hilo, kwa sababu ni swala nzito, na tunaona naibu wa rais akiendelea kukagua tu yapi ambayo yanaonyeshwa katika vituo mbalimbali. Si vituo ambavyo vinafanya kazi hapa, lakini maonyesho tu.
Na tumesema kwamba ni different health sectors,
Kuna wale wafadhili, kuna wale ambao wanatayarisha vifaa hivi, kuna wale ambao wanapeana ushauri. Usisahau pia kuna watafiti kama Kemri ambao wanafanya utafiti wa masuala ya
National AIDS Control Unit and the Systemic Team ambao pia ndio wametufadhili pia na sisi kuwa hapa. Kwa hiyo lazima tushukuru kwa hilo. Nimezungumza hapo awali na ambaye ni mkuu wa Kenyatta Hospital. Pia pale naona pia wana kiwanda chao. Kwa hiyo ni vizuri na sisi tupate fursa ya pia kuwatembeza watazamaji wetu waweze kuona hivi viwanda vina nini, na je, wewe ukiwa kaunti nyingine tofauti na Kericho una uwezo wa kupata hizi services popote kule ambapo uko, kwa sababu unajua the services are very, very important. Sometimes we actually say we perish because we lack the knowledge, we lack the understanding. So this is the moment for us to kagua na kutafiti kama ulivyosema. Alafu sisi tunahakikisha ya kwamba wewe umejua, na unapojua unajua wakati ambapo nimepatikana na tatizo hili
kunafanywa vipi,
ni wapi ambapo unakimbia mwanzo.
Pia Linda, umezungumzia hili swala la kukinga kunradhi yale magonjwa ambayo ni sugu. Ikumbuke kwamba National Syndemic Disease Control Council wao wanajukumika katika kuangazia yale magonjwa ambayo ni sugu. Ugonjwa kama wa ukimwi, ugonjwa kama wa malaria, ugonjwa kama wa saratani, wanahakikisha haya magonjwa yanadhibitiwa vilivyo, kwa sababu wao ni lile baraza la kudhibiti. Na wao wakiwa wadhamini wetu, tumeweza kuangalia, nikikumbuka katika miaka ya nyuma, kwa sababu wamekuwa washirika wetu wa karibu, tumeweza kuzungumzia masuala ya kupambana na kudhibiti maambukizi ya virusi vya ukimwi. Na vijana wengi kulingana na ule utafiti ambao ulitoka awali, vijana wengi hawajikingi kutokana na masuala haya, na ndio maana unaona wanatoa ile mipira ya kushiriki ngono ama ukipenda mipira ya kondomu. Unapata kwamba wao wanajukumika katika kufanikisha hilo, kumaanisha hamasisho linahitajika. Sijui wewe umepata hamasisho kwa
nafikiri kufikia hapa nashukuru kwamba niko hapa nazungumzia haya masuala ya afya kwa sababu wajua wakati mwingine huenda labda hauna haja ya kwenda kufanya hilo,
lakini wakati ambapo
unazungumzia hili inakuwa ni vizuri. Wakati ambapo tunakuwa ilikuwa ni siri kubwa sana, ilikuwa ni vigumu sana kusema mipira ya kondomu wakati ambapo unawatazama watu kwenye televisheni, lakini wakati huu nafikiri ni mazungumzo ambayo yako wazi. Kwa hiyo it will be bad if any of us is going to perish because they lack this knowledge, because knowledge is out here, and these different stakeholders are making sure that this knowledge then is spread across the different parts of the country. We need to make sure that, you know, our young turks are enlightened about this, our youth are enlightened about this. You know, let them be exposed to the aspect of care, the aspect of just making sure that they prevent themselves from these cases, because reality is that, you know, cases like HIV and AIDS are there. They are in existence. But what will it take for them to make sure that we zero the number? It is simply hamasisho kama unavyosema.
Kikubwa ni kukuwa na sufuri. Watu wasije wakapata maambukizi. Ndio. Alafu Linda, kikubwa pia
ni kuhakikisha kwamba wale watu ambao tayari wako nayo ambao wako nayo pia wana uwezo wa kuishi maisha marefu. Maana kuna huo uwezekano, sio? Kwa hiyo kula vizuri, hakikisha kwamba umefuata maagizo ya daktari, fanya mazoezi, kunywa dawa,
tuko sawa. Alafu Linda, umezungumzia swala hili la afya katika jamii, na ikumbuke kwamba kuna swala ambalo linarudisha juhudi za kukabiliana na magonjwa kama haya nyuma. Kuna hili swala la unyanyapaa katika mambo mnasema stigma. Unapata kwamba jamii ikiona mtu ni mgonjwa wanaanza kumtenga, wanasema kwamba tukiwa na huyu mtu tutapata ugonjwa, na si kweli. Kwa sababu wadau wa afya wanasema kwamba magonjwa mengine hayaambukizwi kwa kutagusana. Eti nikikushika mkono hivi nikikushika hivi nimepata ugonjwa wa ukimwi. Hamna, kwa sababu ni mambo ambayo yanaambukizwa kwa njia zingine. Na ndio maana hamasisho linaendelea. Hadi leo nimeweza kupita katika kipanda kimoja ja pale watu wa NSDCC. Wanaendelea tu kuzungumzia ile, wanasema kwamba
ajabu, unajua unaweza ukafikiria kwamba watu wanajua tayari, kwa hiyo ukaacha kuzungumza. Watu hawajui. Kweli watu hawajui. Unaambiwa kwamba usicheze na yule mtoto kwa sababu ya hili na hile. Nafikiri haifai hiyo.
Alafu inaudhi kwa sababu ni mtu kama wewe, unamtenge.
Wajua nahisi kwamba what you're saying is very important. Awareness creation is crucial to every health condition. It is important that people constantly create awareness, because that is the only way that we are saved from this difficult. So I agree with you that we need to constantly have this conversation. Na napenda kwamba the theme of the day is universal health coverage, ya kwamba tunazungumzia magonjwa yote au hali zote zile za afya, na umuhimu wenyewe ni kwamba tunapozungumzia maneno haya au magonjwa haya tunahakikisha kwamba tunazungumza ni jinsi gani tutakwenda pale chini mashinani kuhakikisha kwamba hawa watu wanaelewa mambo yanavyofaa. Kwa hiyo nimeangalia pale, nimependuka pande na unaona kwamba wanasema health system.
namna hii.
Ndio. Unapomwona mwenzako labda anaugua ugonjwa fulani, je, unamtunza vipi?
Ndio, anahitaji kula nini?
Una uwezo gani wa kuhakikisha kwamba amepata hiyo chakula? Na unajua ni jinsi gani unaweza ukapata usaidizi iwapo hauna hela za kutosha. So pia we have to acknowledge the contribution of the donor community in terms of making sure that we access medication, in terms of making sure that we access foods that are rich nutrition-wise. So that is basically what universal health coverage is about, Onsari. And I am impressed that indeed we are getting somewhere as a country.
Kabisa. Na Linda, umezungumzia hilo swala la taifa kupiga hatua katika masuala ya afya, na tukiangalia katika hili swala la mpango wa afya kwa wote, ni mpango ambao umejaribiwa mara 2 na serikali iliyopita, na sasa tumeona Rais William Ruto akiwa amaliza, huu ni mwaka wake, anaingia kwenye mwaka wa 2. Tuseme tu anamaliza. Na tumeweza kuona kwamba amevalia njuga hili swala la afya kwa wote. Na hii afya kwa wote ni swala ambalo lilikuwepo kitambo. Lakini
nasema kwanza tangia wakati tulipata uhuru. Tangia huo wakati, kwa sababu tulikuwa tunasema tunapigana na poverty. Wanasema kwamba tunapigana na disease. Wanasema kwamba tunahakikisha watu tunapigana na illiteracy. Kwa hiyo very important that we speak about the health sector. Kuanzia hapo mwanzo.
Iwapo watu wanajua wanachopigana nacho, na tumai kwamba wataweza kukabiliana nacho.
Vita vitakuwa rahisi,
na watakabiliana nacho. Kwa sababu ukizingatia kwamba kuna magonjwa ambayo yana dalili ambazo zinakaribiana. Na utapata kwamba Wakenya hawajui kule mashinani. Na labda hili swala la mpango wa afya kwa wote, maafisa nyanjani, community health promoters, tunatumai kwamba litaweza kufika pale. Na hivi sasa tunaangalia mvua El Nino ambayo imetangazwa, tunaitarajia katika kaunti zingine. Na naelewa fika au maafisa wa afya nyanjani watajukumika, kwa sababu kuna magonjwa ambayo
yanaletwa na mvua,
waterborne diseases, mnayaita hivyo katika ile lugha.
Kuna hizi ambazo tu utapata ni homa ambayo inaletwa na baridi. Kwa hiyo ni
kweli. Ndio, na tutakuwa tunatupia jicho hilo. Na hivi sasa waziri wa afya Susan Nakhumicha yuko katika uwanja huu wa Kaptatet, na vile vile tuko naye naibu wa rais Rigathi Gachagua. Labda kwa kiduchu tu, shughuli imekuwepo kutoka asubuhi. Ndio umekuwa ukifuatilizia. Niliona ukizungumza na wadadisi wa masuala ya afya, watafiti na vile vile wataalam. Labda gusia.
Kweli ni kwamba tuwakumbushe pia kuna watu ambao ni muhimu sana katika suala hili, viongozi wa kaunti. Nimemwona gavana wa kaunti hii,
Daktari Eric Mutai,
watachangia pakubwa hasa tunapozungumzia afya mashinani. Kwa hiyo mashinani ni jambo ambalo ni la ugatuzi. Ni jambo ambalo la watu. Kwa hiyo kaunti itahusishwa vipi? Kindani, kikweli,
kwa sababu swala hili limegatuliwa.
Tena la ugatuzi. Na kuna watu wengi ambao wamekuwa na tashwishwi hapa na pale, kama ilikuwa ni bora kugatua swala la afya. Wengine wakasema labda turejeshwe katika serikali kuu. Wengine wakasema labda tupate na sisi commission yetu. Utaita commission kwa
ile tume ambayo itakuwa inasimamia afya.
Kama tulivyo na ile ya masuala ya elimu. Kwa hiyo kwa sababu tuna tume ya elimu. Kwa hiyo wengi wakasema basi na tuwe na hiyo. Kwa hiyo we have been talking about this, and we just need to understand beyond talking. How do we ensure that this is not lip service? Beyond this beautiful conference, how do we ensure that this is realized? Beyond what is enshrined in the Constitution as to the aspect of health and how everyone has the right to access health, how do we ensure that indeed they get to experience the best of the health sector? So that is basically what we're talking about. And I'm sure you can hear all the allegations out here. We also have students. Makaribisho. And I am glad that students are being involved as well, so that they also understand, even as they grow, what the country envisions for them, what the country is making sure that, they get in terms of health and all that. So we have students from different, institutions that have as well joined us here for this very session. So I think it's all about getting to wait and see first what the leaders of the nation have in store for us. And Joash Onsari, you can evidently see that the Deputy President, as well as the CS for Matters Health, the PSs, as well as, the various guests that are invited here, are on different booths, just trying to witness what the different sectors have in store, what they have prepared, how different, and I mean, the health sector is quite intense and huge. And there are a lot of things therein that, like we agreed earlier on, is important that the people get to witness and see, so that unajua wakati ambapo labda umepata kansa au saratani, ni sehemu gani ambapo utakwenda, the oncology center,
ni wapi unafaa kwenda,
ni wapi ambapo unafaa
na Linda, tukizungumzia masuala yao ya afya, tukiangazia magonjwa sugu, na mtazamaji akiendelea kutufuatilia pale nyumbani akiangalia kwenye kiumbo chake, maandalizi hivi sasa yako kilele chake siku ya leo, ambapo waziri wa afya Susan Nakhumicha akiwa na mgeni wa heshima ambaye ni naibu wa rais Rigathi Gachagua anapiga kutembea katika vibanda ama katika vituo mbalimbali vya muda katika uwanja huu wa Kaptatet ili weza kujionea ni kipi kinajiri. Na tuliweza kuona hapo awali kuna vituo mbalimbali wa Kenya wakiwa wamefika katika uwanja huu Kaptatet, shughuli nzima ikiwa mpango wa afya kwa wote, shughuli hiyo ambayo tutakuwa tunakupeperushia mubashara kupitia runinga hii ya TV47, runinga ambayo imekuwa kwa kasi zaidi humu nchini, na kikosi kizima nikiwemo hapa katika kaunti ya Kericho nikiwa na mwenzangu Linda Alela, tuko naye Chelangat na akina Cheptoboit kutoka Radio 47. Yani tutakuwa tunakupeperushia haya yote mubashara ili tuweze kujua ni kipi kinajiri. Huyo ndo naibu wa rais Rigathi Gachagua akiweza kupiga gumzo na wale washikadau kutoka mashirika mbalimbali, kikubwa kuangazia namna afya na mikakati yake inawekwa kuhakikisha Wakenya wanapata afya bora na si bora afya siku zote.
Wanasema kwamba afya bora sio bora afya, nakubaliana na hilo ya kwamba unatakikana kushangilia kuwa Mkenya aswa, isiwe tu kwa sababu ni porojo au unazungumza tu. You need to experience this, and I think from there we'll definitely get to see the program kickstart officially, certainly welcoming remarks that we'll get. We'll also have the delivering universal health coverage through digitization conversation. How did we get to the aspect of digitization? The story of the health data in Kenya will be accorded to us. We just get to the evolution of health data in Kenya. Just how well do we ensure that we go paperless in terms of, just digitizing the whole aspect of the health sector, the benefits of the digitization bit, the case study, and of course we'll be focusing on Kitengela Sub-County Hospital, yes, as the main case study. And we also just get to understand the role of the development partners in the health digitization. Remember, today the program is on that one pillar of digitization. So digitization of the health ecosystem, and what then is the envision as a country. So we'll also be having the speeches from these various guest of honors, which is very, very important. And from them, then we'll get to establish what it is that the government intends for us to achieve with this great and memorable day.
Ndio, Linda, na ukizungumzia swala hilo isisahau kwamba hatuangalii afya tu kwa kuangalia watu wazima. Unaona kuna wanafunzi ambao wamefika hapa ili kuweza kutumbuiza na vile vile kuweza kujifunza mawili matatu, kwa sababu hawa ni wanafunzi ambao moja, wawili, watatu wanaweza pania kuangazia masuala ya afya, kuingia katika hii sekta ya afya na kuwa madaktari.
That is what we call assured. Lazima kutakuwepo mmoja ambaye atakuwepo. Lazima. Kweli kabisa. Kwa hiyo yes, ni very, very important ya kwamba we involve the children, so that even as we create this journey, they are part of it. They contribute to this growth. So eventually they'll say, I remember what it is that the Deputy President said then, what it is that the CS for Health said then. And I think we have come to witness this. It was different then when we were young. It is now different when we are old. This is what we did. And now that we're in the health sector, what do we envision? Vision is very important. Nafikiri, every time we're having a conversation about a nation, we're thinking about the future. We keep thinking about our children and their children's children. And we keep saying, where will the youth be tomorrow? So as we prepare this, Joash, perhaps you might not even get to see the benefits of the same, but you certainly want to see your child get the benefit of this.
Yes. Asante sana Linda, na nikiweza kuangalia pale wanafunzi ni wanafunzi wa shule ya upili ya wasichana ya Tengecha ambao wamefika hapa. Ni shule jirani katika uwanja huu wa Kaptatet, na ni majirani wa karibu sana, na huu ndo uwanja wanaotumia kwa michezo, na wameweza kufika. Na mtazamaji Ukiangalia pale naibu wa rais Rigathi Gachagua yuko na waziri wa masuala ya afya Susan Nakhumicha, wanasikiliza, wanapata lile dokezo kwamba ni kipi kinatarajiwa, kwa sababu washikadau ni tofauti. Kuna wale ambao watakuja waseme sisi tuko tayari kufadhili masuala ya afya. Kuna wale ambao ukumbuke, ukizungumzia lile swala la kule kutengeza vifaa vya kutoa tiba. Ulisema kwamba katika taifa letu la Kenya mikakati ishaanza kuwekwa. Hata rais amesikika akisema kwamba tutawapiga jeki wale ambao watakuwa wanaangazia swala la kutayarisha vifaa ambavyo vitatumika katika kutoa tiba.
Ndio. Na unajua hivyo vifaa kila wakati tunasema tusiwe tu tuna vifaa vizuri au we have very nice facilities that are not being put to use. So we also need to find a way of creating that balance such that we're not going to have the best of facilities, you know, with all the equipments that are needed, yet these equipments are not being put to use. I've had a session with the stakeholders within the Ministry of Health as well. They say they want to create a balanced ground. They want to ensure that all these components are put to use, such that we're not going to have beautiful policies that are not implemented. We're not going to have this, you know, components that are on ground but they're not being put to use. Hatuna wataalam pia. Kwa hiyo pia wakasema ya kwamba na tusichukue tu wataalam for the sake of taking wataalam, you know. If they travel from different countries to the nation, let us understand their curriculum there. Let us understand the progress that they have gone through in terms of attaining this form of education for health, so that when they come to the country, then we are guaranteed that they are going to offer quality services to the people. And I hear that the deputy is almost getting in. Yes.
Naibu wa rais Rigathi Gachagua atakuwa anaingia katika ukumbi ama katika ukumbi wa muda tu ambao wamejenga tu kwa shughuli hii, na akishaanza kuzungumza nasi hatuna budi kuweka hizi mikrofoni chini tusikilize pia. Alafu Linda, kwa faida ya mtazamaji wetu, ni matangazo ambayo tunayapeperusha mubashara kupitia akaunti yetu ya YouTube TV47 Entertainment, na vile vile tutakuwa tunakupakulia hizi taarifa kupitia pale kwenye X, awali wakisema ndio Twitter.
Na usije ukamsahau kwamba tuko na Cheptobo 8 ambaye ni wa Radio 47. Kwa hiyo pia pale tutapata kukuambia ni lipi ambalo linaendelea pande huu, au ni kipi ambacho kilizungumziwa, mikakati yapi ambayo yamewekwa, serikali inanuia kufanya nini. Kwa hiyo Cheptobo 8 atahakikisha kwamba wewe ambaye ni msikilizaji wa Radio 47 pia umefanikisha kuelewa hii wiki nzima ambayo tuko katika kaunti ya Kericho kunani.
Hivi sasa natumai tutakuwa tunasubiri wimbo wa taifa, na wakati wowote kutoka sasa naona yule msherehezi ama ukipenda MC Chipu yuko tayari bwana, anataka kufanya mambo yake. Naona kuna msaidizi wake vile vile. Tutakuwa tunasubiri kuweza kujua ni kipi kinajiri na tuweze kufahamu fika sherehe zinaanza vipi, kwa sababu wimbo wa taifa ndo fungo wa kazi.
Pale nyuma nasoma drone solutions. Uliona ile drone solution? Nafikiri kwa sababu leo tunazungumzia digital movement. Drone solutions kitu cha maana
kitu cha maana. Ikumbuke kwamba kuna moja ya kaunti kule katika ukanda wa Nyanza, shughuli nzima ya kuweza kupeleka dawa katika boma mbalimbali itakuwa inafanikishwa. Alafu nikiangalia ile namna walivyokuwa wameandika, hawaangazii tu afya peke yake, hata wanaleta suluhu ya masuala ya kilimo. Iwapo nzige wamevamia mimea yako, basi wanakuja, imefika. Inaweza kukabiliana na wale nzige. Kumbuke miaka michache iliyopita shughuli nzima. Tupate wimbo wa taifa.
Bismillahirrahmanirrahim. Kwa jina la Mwenyezi Mungu mwingi wa rehema mwenye kurehemu. Mwenyezi Mungu, tumekusanyika hapa katika siku ya leo, na wewe Mwenyezi Mungu ndiye mlinzi wa wote. Wewe ndiye mwenye kumimina baraka juu ya kila kitu. Tuongoze katika kikao hiki. Wewe ndiye tunayekuabudu na wewe ndiye tunayekuomba msaada. Tuongoze katika njia iliyonyoka, njia ya wale uliowaneemesha, wale sio wale waliopotea. Mwenyezi Mungu, tunakuomba afya. Binadamu tukiwa na afya tunakushukuru usiku na mchana. Vitengo vyote vinavyosimamia afya, Mwenyezi Mungu, tunakuomba weka baraka na rehema na mkono juu yao. Na sote tunaohitaji afya hii, Mwenyezi Mungu, jalia afya hiyo iwe ni afya yenye kutufaa sote tulioko hapa na ambao hawako hapa. Na Mwenyezi Mungu, tunaiombea serikali yetu, weke mkono juu yao, wape mwongozo, wape nyayo zisimame katika hali ambayo sote tutashukuru kwa ajili yao. Na kwa ajili yako Mwenyezi Mungu tunaomba, tukiamini kuwa utatukubalia maombi yetu. Rehma na amani ziwe na manabii waliotangulia. Amen.
Our Heavenly Father, we come before your presence to exalt you this day, to thank you, my Father, because of this conference. We invite you, our Lord Jesus, we invite your Spirit, that you will walk together with us throughout this week as we do the conference. And we pray for your grace, we pray for your power, we pray for your wisdom, that, Lord, as we go through this program for universal health coverage, Afya Nyumbani, that your blessing shall be upon this program, that this program will bring prosperity to our health sector, and even the locals will be able to get the services. Thank you for the government, thank you for the president, the deputy president. Thank you, Lord, as they push this agenda. We pray that you go together with them. May you bless our county Kericho. May you bless Kenya. May you bless our healthy services in Jesus' mighty name.
Naomba tuketi tafadhali. Tuwapigieni makofi tafadhali. Our deputy president, kindly, with your permission, allow me to request we receive you properly in Kericho. Wapi nduru, shangwe, vigelegele za makamu wetu wa rais. Asante sana, karibu sana. President, all protocol. Allow me to introduce celebrations, Mr. Dennis Kumbi.
you. Your Excellency, Honorable Deputy President, Honorable CS Minister of Health, Honorable Governors of Kericho County, all the CSs, PSs, and all the national county government officials, development partners in the private sector, all protocols observed. Thank you for having me here today. It's truly an honor to be part of this momentous occasion. This week's celebration marks a national shift in healthcare, one that moves towards a more affordable, accessible system for all Kenyans. I would like to start by recognizing the leadership of the Kenyan government, the President and the Deputy President, through a primary, as both the national and county levels, the Kenyan government has embraced the principle of primary health care and is truly advancing His Excellency President William Ruto's bottom-up economic transformation agenda through universal health coverage. After decades of vertical programs focused on preventing and treating individual diseases, we now have an opportunity to take a more holistic approach that puts the patient at the center of Kenya's healthcare system. The launch of UHC in Kenya aims to reduce health disparities, enhance equality, and combat major infectious diseases. I can honestly say the last time I saw so many development partners rally around the Kenyan government's vision and get so much done was during the early days of COVID-19 pandemic. It's remarkable what we have done collectively to achieve in preparation for Mashujaa Day. USAID has worked closely with other U.S. government agencies like the President's Emergency Plan for AIDS Relief, the U.S. Center for Disease Control and Prevention, and the U.S. Department of Defense, as well as many other development partners, including UNICEF, WHO, UNFPA, and AMREF, to support the efforts of the Kenyan government to expand primary health care across the country. In conclusion, the pursuit of universal health care in Kenya represents a shift towards equitable, accessible health care for all. With strong partnership, unwavering dedication, and strategic initiatives, together we can realize a brighter, healthier future for all Kenyans. I look forward to what the rest of this week will hold. Asante sana.
Deputy President, His Excellency Rigathi Gachagua, Governor of Kericho, Dr. Eric Mutai, CS of Health, Dr. Susan Nakumicha, allow me to ride on established protocol. The rain is coming, so we should hurry. It treats its weak, making crucial decisions that will define the very fabric of our society. The issue at hand is not merely about healthcare, but about the fundamental values that we as a nation hold. That regardless of their financial without as a purpose-led, we must be using technology to strengthen. Our support aligns with the four and more the infrastructure, storage, and security over 1,000 devices to the of these devices assembled locally by smartphones. Dedicated of the healthcare system, this transformation. We 5G to ensure science amongst others. Let us join a healthcare system that transcends financial barriers, that prioritizes the sanctity of life, and that champions the very hard to think.
Tumpongeze kwa makofi tena tafadhali. Your Excellency, allow me to invite a WHO representative to make a few remarks, kindly. WHO. Kuja tafadhali.
State Department of Medical Mariuki, PS State Department of Public Service and Profession, Dr. Patrika, Director General, Ministry of Health, representatives, agencies, partners, and donor organizations, members of the Fourth Estate media, all protocol observed, ladies and gentlemen. It gives me great pleasure to join you today for the Universal Health Coverage launch. I would like to extend our heartfelt congratulations to Kenya for its remarkable commitment to achieving universal health coverage within the broader framework of Sustainable Development Goal 3 by 2030. Kenya's journey towards UHC through a transformative primary healthcare reform process, adopting the primary healthcare network model to create a people-centered primary healthcare service delivery system is truly commendable. The unwavering political commitment and leadership that drove the transformation is simply unmatched. And it will be key in achieving the desired results. Globally, commitments towards achieving primary health care have been integral in advancing the goal of health for all. The World Health Organization's Alma Ata Declaration in 1978 was a pioneering step, emphasizing the importance of PHC as the cornerstone of a functional healthcare system. Subsequently, the Sustainable Development Goals have reaffirmed the commitment to PHC, particularly Goal 3, which seeks to ensure healthy lives and promote well-being for all at all ages. Additionally, the Declaration of Astana in 2018 renewed the world's commitment to PHC, recognizing it as a key driver of UHC and health equity. These global commitments have laid the foundation for prioritizing PHC, strengthening healthcare systems in Kenya and around the world, and working collectively to ensure that quality health services are accessible to all, leaving no one behind. By strengthening community health deliveries and enhancing community facility linkage, Kenya has empowered its citizens and improved access to health care, leaving no one behind again.
This achievement is a testament to Kenya's dedication to a healthier, more equitable future, and we applaud your commitment to this noble cause. It is evident that Kenya's journey of growth and learning to enhance the health and well-being of its people is a remarkable milestone, one that resonates with the very essence of our mission at the World Health Organization. We at WHO are proud to stand alongside Kenya as you celebrate 60 years of progress and as we commemorate our 75 years of service in global health. The significance of primary health care and universal health coverage cannot be overstated. These are not just lofty ideals, they are the cornerstones of a healthier, more equitable world. In our journey, partnership is key towards ensuring full alignment and harmonization in providing support to the Kenya health systems. For that, the Development Partners for Health in Kenya, DPHK, was established, guided by 8 effectiveness principles set out in the Paris Declaration and further elaborated by the Kenya Development Effectiveness Group, DEG. Allow me to convey the congratulations of our 35+ members to the government of Kenya on the milestones we are celebrating today, and assuring you that DPHK will continue to work effectively with the government of Kenya through the different channels identified in the endorsed partnership framework to maximize the inputs of our support towards universal health coverage in Kenya. No doubt, the significance of health system strengthening cannot be understated. The pillars of health system strengthening, ranging from health workforce to health information systems, health financing, medicines and health products, not to forget health governance, are the very building blocks of a resilient and effective health system. To attain our PSC goals on the path to universal health coverage, we must continue to focus on several key elements. Prioritizing primary health care at all levels of leadership, increasing investment in primary health care facilities for improved quality, ensuring financial protection, granting autonomy and sustainable financing for healthcare facilities, shifting to integrated service delivery, and embracing digital technologies for data-driven decisions. These factors are essential to our journey towards achieving UHC, necessitating collaboration and innovation. Our commitment at WHO is resolute. We stand by Kenya's side, offering our expertise, knowledge, and global best practices to bolster your health care systems. Together, we will forge ahead, driven by the vision of UHC. In this moment of celebration and reflection, let us renew our dedication to UHC and the principles of equity and access for all. As we applaud Kenya's remarkable journey and milestones, let us also celebrate our shared commitment to a healthier and more prosperous future for all Kenyans. Let us continue our collaborative journey towards UHC with unwavering determination and solidarity. Asanteni sana.
Tuwapigie all our partners makofi tafadhali, WHO, Safaricom, and USA. Thank you so much. Your Excellency, with your permission, allow me to invite PS Mudhoni to take us through to the next part of the program. Tumkaribishe PS kwa makofi tafadhali.
Your Excellency, the Deputy President of the Republic of Kenya, our CS, Madam Susan Nakumicha, CS, Madam Leba, Madam Bore, and all protocols observed. Good afternoon. Good afternoon, everyone. Your Excellency, allow me to first recognize my colleague, PS Kimutai, please move to the crowd. We have had sleepless nights working on this project, and I am glad that this is the day that the Lord has made. Hata mvua imenyesha. Allow me to recognize the CEO and Secretary, Public Service Commission, Dr. Simon Rotich. Allow me also to appreciate that Her Excellency, the First Lady of the Republic of Kenya, sent a representative because she's away, Dr. Chumo. Your Excellency, primary health care is the cornerstone of health. And that is why I would want to introduce two people on the stage on community health, that is Professor Dan Kasenje and Miriam Were. And I would wish the moderator of this forum to come to the stage to take us through. I would want to say that PHC is Integrated Comprehensive Services, which promotes equity, ensuring no one is left behind. We are creating a scenario in this country where healthcare is accessible, available, and affordable. Kindly come on stage. And community health services places all this at the center stage, at the household and at individual level. We are making a shift from curative to preventive and promotive. Please. The moderator is going to take us through this short session.
Your Excellency, the Deputy President, all protocols observed. My name is Julius Mbea, and I represent partners of the Ministry of Health working at community level, the community health units for universal health coverage. Thank you for having us. And it's no great opportunity to bring to you two eminent Kenyans who have been at the forefront of community health. And for that reason, I will do a brief introduction of Professor Miriam Were, which is a household name in community health in Kenya. Professor Were obtained her PhD in community health in 1981, having been the second class of medical students to ever be trained in Kenya through the University of Nairobi. She has served with the government of Kenya, UNICEF, WHO, and has been awarded several awards, including the Noguchi Prize for outstanding work in community health. Professor Were says that her biggest achievement is being the moment that we are seeing today. From being called Daktari wa Mavio, Daktari wa Latrines, to the moment that the government of Kenya has renewed its commitment to community health and has committed community health as the vehicle of achieving UHC. Professor, we welcome you. Dakika moja tu.
Asante sana. Hamjambo. Hamjambo tena. It's a great pleasure to be here today. Mzee Were is there. Papa, please stand. He has been on this journey of primary health care with me for the last 70 years or so, because when I went to train as a medical doctor, everyone thought I was going to be in a hospital. Even I thought so, until in the process of studying medicine, sorry, wakubwa wangu, Your Excellency, the President, I am a village girl. So, no offense meant. So when we started this channel, people said, we thought you were going to study medicine. Now you are in the village. Now you are talking about people having latrines and using them. So they called me the doctor of latrines. And for many years, my medical colleagues called me professor of latrines and dismissed me. But I think the first point I want to make is that the focus of our work should be, is it helping people? Is this approach moving people to another level? That is the focus of our work. So whether I was a doctor of latrines or whatever, it didn't bother me so long as I saw that diarrhea was going down, children were being less malnourished, and so on. So this is the approach that I think we should. And I'm very happy to be here today because I can see that the leadership of the Ministry of Health is pushing the approach to improve health services. So I'm very happy to be here, Madam Minister and your colleagues. And in this kind of work, you don't work alone. You work with many people. And one of the people that I have worked with over the years, he's a little younger than me, or is it a lot younger than me? I don't know his age. I am 83 years old myself. I don't mind sharing my age. And has been Professor Kaseje. And I particularly appreciate the fact that he has taken the training program for people to manage community health services as his priority. While I took my priority as getting the implementation of community health and primary health care, I thank God that my younger brother here has taken the preparation of health workers to carry on that work. So all I can say is all the best. Kenya is on the right footing. Madam Deputy President and all the leaders. Madam Deputy President. We are on the right road. And in spite of age, some of us are still prepared to work very hard so that Kenya makes it to health for all by next year. Why not next year? Thank you very much.
Your Excellency, the Deputy President, Your Excellency, senior government officials, ladies and gentlemen, good afternoon. It is indeed a very great pleasure to share the podium with my senior sister and friend, Professor Miriam, as we celebrate together with you what we have been laboring for over many, many years. So this week we gathered to celebrate the commitment of our government to ensuring that access to health is available to everyone without distinction, recognizing that it is indeed enshrined in our Constitution that health is a fundamental right. And so we gather then to celebrate together with our leadership, guided, of course, by the many declarations that our WHO colleague outlined for us. The declaration at Alma-Ata and the declaration at Astana in 2018, highlighting some of the pillars that must be included in any program or system that will make healthcare accessible for all. The first one being, of course, focusing on equity which is ensuring that everyone has access to achievable health that they need at every stage in their lives. The second one being that this requires inclusive participation, and therefore the training of CHPs and the educating communities to be able to effectively engage in health improvement is a very important strategy that must be included. The third, of course, is the multi-sectoral collaboration and partnerships in order that we can work together across the sectors to ensure that we create an enabling environment in which people can achieve and maintain good health. Of course, we are committed to the provision of the essential package, knowing that our non-communicable diseases is increasing and the burden for care is far beyond what health facilities can provide. And therefore, we welcome really the commitment to include the CHPs in the provision of healthcare at community and even household levels. Thank you, and may God bless you as we continue to celebrate together.
Thank you so much. Primary health care may not be a success without the collaboration of the two levels of government, the national government and the county governments. At this juncture, I wish to, with your permission, Your Excellency, to invite the Governor of Kericho County, His Excellency Eric Mutai. Mambo ni matatu, accessible, affordable, and available.
Thank you so much. Thank you so much, PS. The chief guest for today is Excellency the Deputy President of the Republic of Kenya. Cabinet Secretary is present. PS is present. All the participants, once again, good afternoon. It gives me a lot of pleasure as the governor of this great county of Kericho to welcome you to this historic event. Indeed, today we are celebrating a huge milestone never witnessed in the history not only of Kenya but also in Africa as a whole. Your Excellency, I want to commit before your presence that being one of the good scholars around, Kenya is a pioneer on these directions we are taking on universal health coverage. Indeed, for a decade, Africa has been riddled with three issues. The biggest one has been poverty, the second one has been disease, and the third one has been ignorance. Disease is one of the biggest impediments towards achieving economic freedom in Africa as a whole. At the moment that we handle disease, the moment we look as a nation and as leadership into how we can deal with matters preventive and prevention right from the village level, it gives us the honor to move even a bigger milestone in terms of safeguarding the wealth of our nation. So many of our people have died in the past and across Africa, and the single reason is out of diseases that can easily or would have been easily prevented if they were diagnosed early. Today, Your Excellency, in your presence, we've been able to see the revolution that has been led by the Ministry of Health in terms of looking into the primary healthcare networks. And we were able to witness tremendous equipment of the universal healthcare promoters in the villages and how they were able to actually diagnose disease at that level and link them to the nearest dispensaries. As COG, we are committed to do our bit, and that includes equipping our dispensaries, our health centers within our locations and our villages so that we are able to assist once the community health promoters have diagnosed diseases, the patients would be able to get medication easily, accessible manner. That is our commitment from the COG. Secondly, Your Excellency, we are committed as devolved units to ensure that we regularly stock our health facilities. Because one of the impediments is that, yes, we have diagnosed the patient, but when we refer to a facility and there is no medication, then it defeats the logic of the whole exercise. We are committed then as COG, in partnership with KEMSA and other industries, to ensure that we all the time and regularly stock our facilities in the villages. Because by stocking the dispensaries, by stocking the health centers, it then conceptualizes and make real the meaning of devolution, because services will be assessed right down in the villages. Lastly, Your Excellency, we are also committed as county governments to ensure that we provide ambulances in all our sub-county facilities and also within the health centers at the ward level, so that in case of referrals, then the patient is not again tasked with the pain of hiring taxis or vehicles, but we are able as government to support them to transport to the nearest facility. All this will sum up to speaking and giving voices to the vulnerable who would have actually lost their lives out of simple diseases that could be handled at that level. As I conclude, we have again witnessed today tremendous innovations that exist within our country. And I want to categorically speak out here that having gone around the pools that we have here, there is a clear demonstration that we have a sound innovation within our hospital facilities, private sector, and even research institute. Our ask as Kericho County is to enable us to also operationalize and run a research institute on cancer, because cancer is so much prevalent in South Rift, especially throat cancer. And we are going to be seeking partnership from the Ministry of Health and in your office to be able to actualize and have a vibrant research center for cancer. I wouldn't want to forget that today we've been able to launch an ICU center at Kaptatet. This was fully funded by the national government. And this is one of the rarest or one of the only ICU centers that you can have around level 4. This also goes a long way in aiding referrals so that you don't need to travel far distance to get ICU for patients. I'm glad to also announce that as a county government of Kericho, today we have an active side for production of oxygen. In the past, we used to go and purchase oxygen from Kisumu. And in the process, we could lose a patient in the process because of the distance. But today at Kaptatet Hospital and also at our referral in Kericho, we are producing sufficient oxygen to run the ICU facilities. Your Excellency, after this function, you will be gracing for us one of our monumental achievements in office with this one here as Kericho County government. We've been able to build a basic oncology unit, and we've been able to equip. This will speak on matters breast cancer, speak to matters of early screening that has been killing our people devastatingly. And we'll be glad today that you'll be able to launch for us that center so that it becomes operationalized going forward. Last, another least, is that feel welcome, feel loved at Kericho County. Sample the best of this county. Make sure that you take tea, and we'll be able also to supply, mobile vendors of tea so that you sample the best of our tea. Around Kaptatet here, we have fresh food at a place here called Vienna. There, you can get some quality nyamachoma, some quality isagek, which is alternative medicine, and also the only rare delicacy called mursik, Your Excellency. It is the only substance that is well brewed across the world. Even Europe has never discovered the science behind it. But we have the science here, Your Excellency. And we feel welcome that we partake of all this as we stay in Kericho. We look forward to having all of us at Mashujaa, and we want to thank you so much, dear Excellency Deputy President, for making Mashujaa happen in Kericho. Almost 90% of why we have this event today is because of your singular effort to push for it to happen. And we really want to appreciate your goodness and your grace for enabling it to happen. As usual, PS, we have a little problem. Permit me to introduce, I will not ask them to speak, the members of the County Assembly of Kericho County and the citizens that are here. And of course, I'll share 1 minute to him so that we proceed. So with your permission, I know the program, this is a state function, and we would have said so many other things, but this is a very tight time for a politician, because I ask God to work on my tongue, so that whatever I say is seasoned and flavored to meet the occasion. And thank you, I've been guided by the Holy Spirit. So with that, I'd like just to introduce our members of the great County Assembly of Kericho, who through their efforts, they have made a success. Kindly stand where you are, so that I just introduce you in the interest of the protocols of the program. We have our majority leader in the Assembly of Kericho, the Honorable Philip Rono. Asante sana, I know we'll have a time to speak when you are in Kericho. We have our host MCA, our good brother Amos Birir. Thank you so much, host MCA Birir. Asante sana. We have Mheshimiwa, we call him Broga, but he's a very good blogger. His name is, he comes from the Bosoni Quad. And we have Mheshimiwa Chepto from Bomet County, our neighboring county. We have the only elected woman MCA in Kericho County, Mheshimiwa Anita Ashandesana. We have Mheshimiwa Bafina, I think, from Kunya. Thank you so much. We also have Mheshimiwa Gabriela from Tebesonik, Asante sana. We have also Mheshimiwa Irene Chebet, who is the leader of Women Caucus in the Assembly, Asante sana. We have Mheshimiwa Etna from Belgut. Thank you so much for coming. We have Mheshimiwa Cheska from Litei. Thank you so much for coming. And we have Mheshimiwa, that is Nyesha from Bomet. And we are saying thank you so much. With that, you are tuko na aspiring women rep in Bomet County called Cherono. Makofi kwake. Asante sana Cherono. Utaongea baadaye. Asante. We have Mheshimiwa Philip Mesto. Thank you so much for being around, and God bless you. And we have Mheshimiwa Sirinjit from Jeborigei. Thank you so much, and you are welcome. I also want and accept this. We have, oh, right here. We have, yeah? Bomet. Who? Thank you so much, Chichir. We have Mheshimiwa Dominic from Kabyanga Ward. Thank you so much for being around. We have the chairman of health. You will be having a session, a panel session to represent the whole assembly tomorrow. Mheshimiwa Maji, thank you so much, and God bless you. We have our vice chairman in health committee, Mheshimiwa Moses. And we have our brother and one of the senior MCAs, Mheshimiwa Tarimbo, and God bless you. Aye. And the speaker of the assembly was here. I hadn't seen him. We have also our speaker of the county of assembly, Dr. Patrick Mutai, and you're welcome so much, my brother. Because of the unfairness of time, permit me, our brother, Excellency DG, just to also introduce you where you are, so that I will not be killed by this state function. You know, we'll say others already in Kericho. We have our lovely brother and our able deputy governor of Kericho, His Excellency Engineer Fred Kirui. Asante sana. Before I end, Your Excellency, just to share in my minute, I want to welcome Barchok, our colleague governor of Bomet, just to say one word. She wants to say one word, this hustler, and the upcoming women rep, so maybe.
President, Nenyon, karibu Kaptatet, naitwa Mea kutoka Chebilat. And Branches again, MB, na kusimama hapa. President, iko tu William, agilenji, achama, okialeweno, kiana nekialeweno, asika chutugoi, konyesha, kama to chutugoi, mi bigire raja President, chanya lugo mwaunda busyak, kwanza Cherono, atinya tabu, so mutai, kogigilewen aki, asante.
Your Excellency, you can have the benefit of shaking your hand and then just that. So that you'll be very. Lastly, yeah. Asante sana. Asante sana. Your Excellency, before I sit, thank you for the excitement. I have a specific request for you in this region. This Kaptatet Stadium is heroic and historical in itself. The first stone was laid down here by the first president, His Excellency Jomo Kenyatta. All right. And so, Your Excellency, being an historical crown that has made kings and demoted others, the last time we were here, we did the biggest rally for our party and our government. My request, Your Excellency, if you look around the stadium, it is not in a good space. I want to request your good office to help us facilitate the constructions of this Kaptatet Stadium. I had equally requested Murkomen for 2 kilometers of road as a way of saying thank you to this ground. And I want you to push our brother Murkomen to finish 2 kilometers of tarmac road within this Kaptatet so that it can also give us life. But I want to appreciate you and the government because you have given us 100 million market. It was 40 million, but as county government, we took so that we have 60 million, 100 million modern market at Kaptatet here. Today was a day of so many things. You are so much welcome, Your Excellency. We are behind you and the President, and we are very loyal, sir. Governor Bachok, please come and say a word.
Thank you, Your Excellency, the Deputy President, who is our chief guest for this function, our CS in charge of health, Madam Susan, Mtoto wa nyumbani, CS Florence, our PSS, the Governor of Kericho, waheshimiwa MBs na MCAs, our partners na wananchi wote, tusalimiane. Bwana asifiwe. Your Excellency, this is not my day, na sitaongea mengi. I just want to join my colleague, Governor Kericho, in welcoming you to our region. Ukiwa Kericho, tuko kitu moja na Bomet, so tuko nyumbani. Secondly, Your Excellency, what we are witnessing today is a very clear demonstration that the Kenya Kwanza government is committed in fulfilling each and every promise ambayo tulipatia watu wa Kenya. And as the Governor of Bomet and Council of Governors, kama vile mwenzangu ameelezea, we are committed kushikana mikono na national government so that we can achieve that promise that we gave to the people of Kenya. Lastly, Your Excellency, as my colleague has mentioned, mambo ya kansa, hasa eneo hili letu la South Rift, iko juu sana. And we want to request, and we are willing, I've talked and discussed with my brother, tutaweka pesa na tushikane mikono na research institutions ndio tuchue hii mambo inatokana na nini, because every week, almost every day, tuna attend mashishi ya mtu ambaye amekufa na ugonjwa wa cancer. So we are willing as the two county governments kuweka pesa. So mtusaidie, we still come for discussion. Madam CS, tuone vile tutashirikiana pamoja ndio watu wetu wasaidike. Your Excellency, karibu sana. Thank you.
We have finished our session, Excellency Deputy President, and now just when you will step over the podium, we'll have the responsibility to introduce the members of parliament who are here. But I have apologies from our area MB Kibet Komingoi, who is out on an official duty, and also our Senator Aaron Cheruyot, who is also out on official duty. And you also have apologies from our women rep, who is not feeling well, Mama Beatrice Kemei. Thank you so much. Let me hand over to the most beautiful peers next to me here. Karibu sana.
your permission, Your Excellency, I want to invite my boss and the CS, the Cabinet Secretary for Health, so that she may address us and thereafter invite you, Your Excellency. Available, affordable, and accessible health.
Your Excellency, the Deputy President of the Republic of Kenya, Honorable Rigathi Gachagua, my colleague, Sister Cabinet Secretary for Labor, Madam Florence Bore Tap-Nyole, Excellency Governor of this beautiful county of Kericho, Excellency Governor of Bomet County, our PSS, honorable members of parliament present, my ministry officials who are here today, all partners present, na watu wa Kericho. Hamjambo. Chamugei tugul. Mko wazima. Your Excellency, today I am very, very, very happy because you and the Excellency, the President, you walked around this country and promised Kenyans universal health coverage. And it was put in a plan. Your Excellency, it has been my responsibility to ensure that what promised happens. And today here, we are here to demonstrate that things are not just being launched in Nairobi, but they are happening on the ground. And we have worked with you since morning. You have been able to see for yourself. So I am very happy and glad that you made time to come today. We have a whole week packed with activities. We actually began on Friday. His Excellency the President graced our local manufacturing expo. And now today, we are talking about primary care network. So I am indeed very happy that you made it. Before I make my few remarks, I would like to invite my sister so that she can come and say hello to the people of Kericho County, which is her home county as well. Karibu, Florence.
Thank you, my sister. Your Excellency, the Deputy President of the Republic of Kenya, Honorable Rigathi Gachagua, my sister, the CES for Health, Susan Nakumicha, our Governor Kericho County, the Governor for Bomet, the two PSs, PS Kimtai and PS Modoni, and the rest of us who are here today. Let me say I'm very happy in what my sister likes saying because of all government approach. I'm here to give her all the support during the launch of the universal health care. We've gone round with His Excellency, and I have few picks that I have seen with this universal health care. That in UHC, there is unity. In UHC, we are able to see primary health care that is cheap, that targets the vulnerable, that has been brought from the high point in the cities to the rural areas. Mine is to say, let's walk the journey. And we thank you, Excellency, because your presence here shows the focus of this government to be able to reach to all Kenyans in every corner. Karibu sana Kericho County. We welcome you. We love you. We love this government. And we want to say we are going to be very happy because Kenyans will have a healthier and happy lives to live. Thank you, and God bless you all.
Your Excellency, in universal health coverage, my ministry officials and I, we did identify 4 main pillars that we are going to use to deliver universal health coverage. Your Excellency, we have the pillar on commodity security. which the President launched on Friday. We want to ensure that if a Kenyan walks into a facility, hataambiwa nunua panado pale nje, atapewa kwa sababu iko kwa facility. So we have capacity build our institution, KEMSA, to ensure that we increase the fill rate. Governor here will tell you, when we came into office, the fill rate was 50% if they did so well. But at the moment, we are headed towards 70%. And our plan, Your Excellency, is that in the next 3 months, we should be at 80%, headed to 100% in the next 6 months. And Your Excellency, we are supporting local manufacturing. Many people think that it's a joke, but they were able to showcase. And we have many, many manufacturers who have products here. And since we are deliberate, Your Excellency, the last tender that was put out by KEMSA, worth 5 billion, 2.5 billion, was ring-fenced for local manufacturers. That is how intentional we are. So we are moving very well on that pillar. Your Excellency, our second pillar, which we started discussion last week and shall be progressing through this week, is on our human resource for health. You know, you can have all the equipment, you can have a perfect building, but if you don't have a health worker, it doesn't work. So we shall also be discussing how best do we have a motivated health workers and how do we manage them. We shall also be discussing the whole life cycle of a health worker, starting from production. And that corner there, Your Excellency, is one of our production units for health workers, Kenya Medical Training College. We are discussing how they move from there up to the time they work and up to the time they exist. Since we have been in office, Your Excellency, we have been able to inaugurate the Kenya Health Human Resource Advisory Council that was non-existent, despite being in the Health Act of 2017. It is only until 2022-2023 that we inaugurated it, and we believe that it's going to be a game changer. Your Excellency, our third pillar is on digitization. You have been able to witness for yourself that we have begun at the bottom, which is the essence of this government, bottom up. The community health promoter has a gadget, and I want to thank our partners, Safaricom. They have been able to support us on that. And Your Excellency, the best thing about those gadgets is that they're locally assembled. Hatujaleta kutoka mahali pengine, ni za hapa Kenya. So it's a demonstration that we are also supporting local manufacturing for digitization. Your Excellency, we are working together with our other partners that have supported us, WHO, USA, to ensure that we put people into a primary care network. And that is how you saw Mr. Emmanuel CNA's name from his village to the health facility to Kaptatet sub-county. His name was there because we are able to leverage on digitization. Your Excellency, this digitization will create visibility for us. You know, kumekuwa na wakora wengi, wale wanafanya health inakuwa very expensive. But this digitization is helping us on health commodity management. You are able to see the items at the level 3 facility. We saw the items at the sub-county, and I'm sure even at the county hospital, we are going to be able to see movement of products. Your Excellency, the last pillar, which I think is the most important, is the social health insurance. What we are going to do for Kenyans to ensure that each Kenyan can access health services without suffering financial loss. And I really want to thank the members of parliament, led with my chair of the health committee who is here, Honorable Bukase. I see my vice chair, Honorable Monene, and one of my committee members, and also the members in the Senate, Your Excellency. They did a tremendous job in working on the bills. So we are just waiting for the final whistle to be blown, and we say, hallelujah. Now the healthcare of this country has changed. Your Excellency, I want to thank you for the support, that you have been a champion of this universal health coverage. And I'm going to do my best. If there's any time I have loved my job, it is this time. Because I can see the impact on the faces of Kenyans. I saw the impact on Emmanuel's face when we were in his household this morning. I saw the impact on the 100,000 community health promoters that we have given kits. Your Excellency, and the community health promoters are very happy because starting this October, they are going to get a stipend. And as a national government, we have put in 3 billion shillings per year. That is not a mean achievement. So I want to thank you. But I want to ask Governor, please, we are in this together. Primary health services is your responsibility. But if we work together for the people of this country, we are going to change the landscape. I know in Kericho you have over 1,600 community health promoters. We are going to work with you. Equally in Bomet, I know you have about 1,900. We are going to work with you to ensure that we change the health landscape of this country. Your Excellency, I have not been working alone. My team at the ministry is an A1 team. We have been playing together very well. My PSS, Modoni, Kimtai, the directors, the Director General, we have been working together as a team. And I want to promise you, this team is going to deliver on all the promises of Kenya Kwanza. With those many remarks, I would like to take this opportunity to ask us all to be upstanding so that we invite His Excellency, the Deputy President of the Republic of Kenya. A round of applause for him. Makofi mpaka afike kwenye jukwaa. Makofi, 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 makofi. Karibu sana Naibu wa Rais.
Thank you. Please be seated. The Cabinet Secretary for Health and the host of this celebration, Susan Nakumisha, the CS for Labor and Social Protection, Florence Bore, who is also a daughter of this great county, the Governor of Kericho County, Wanamtai, the Governor of Bomet, the Chairperson of the Health Committee in the National Assembly, Dr. Pukose, Minister of Health and county officials, all other partners, our gallant health workers, the great people of Kericho County, distinguished guests, good afternoon. God is good, and all the time. Unisalimie kwa haya. Bwana Yesu asifiwe. Bwana Yesu asifiwe tena. Pokeeni salamu nyingi sana kutoka kwa Rais wa Jamhuri ya Kenya, Daktari William Samoei Ruto. Our President is away in the Republic of China on official duty, and he sends his warm greetings and love for the people of Kericho and the neighboring counties. Before I say one or two things, let me introduce the members of the National Assembly who came with me. We have Dr. Pukose, he's the chairman of the Health Committee in Parliament and a member of Parliament for Endebess in Trans Nzoia County. We have Patrick Munene, the vice chairman of the Health Committee in the National Assembly and member of Parliament for Chuka Igabangombe in Tharaka Nithi County. We have that tall man, Duncan Maina Madenge, a member of the committee and member of Parliament for Nyeri Town constituency. We have the Honorable Ken Aramat, the member of Parliament for Narok East and the chairperson of the Energy Committee in the National Assembly. We have Honorable Tonkei, the women representative for Narok County. And we have Honorable Charuret, where is he, the member of Parliament for Kipkelion East of this county. Ladies and gentlemen, we meet here today under the theme, Universal Health Coverage, Afya Nyumbani, a few days after our president flagged off over 100,000 community health promoters to work in our 47 counties. It is also a great occasion to witness the potential of the Kericho County Smart Primary Health Care Network, which is envisioned to transform healthcare service delivery through digitization of data. I congratulate Governor Mutahi and his entire team in establishing this digital system. It already defined how we work for our people. Indeed, integrating digital technology is one of the best strategies of ensuring efficiency and effectiveness in service delivery. Distinguished guests, on this note, I wish to commend the health community, the community health promoters who have been engaged for this assignment. You are our heroes this Mashujaa Day. We can't pay you enough for the splendid work you are already undertaking. Once again, we count on your utmost dedication to deliver to Kenyans the promise of universal health coverage. Distinguished guests, October is significant to Kenya and the world. During this month, we work to raise awareness on cancer, and in particular, breast cancer. Cancer is one of the leading non-communicable diseases which collectively kill about 27% of our people annually. In some cases, non-communicable diseases and conditions account up to 50% of hospital admissions. This overstretches our healthcare system, therefore negatively impacting on quality service. Quality healthcare is very expensive for most families. Serious health conditions are sinking families into abject poverty, as many Kenyans cannot access healthcare insurance. In fact, only about 26% of the more than 53 million people have some form of health insurance cover. When a serious medical condition strikes, poverty is inevitable for most families. Poverty strips off one's dignity. This, in turn, slows our development. Your Excellency, governors, distinguished guests, this is one of the reasons that the Ruto administration is investing in promoting preventive health care to the grassroots in collaboration with our counties. This is alongside the ongoing reforms in the National Health Insurance Fund to enhance access to quality health care as enshrined in our Constitution. We are closely working with counties in establishing sustainable structures of promoting preventive health as envisioned under the universal health coverage. In this regard, we have allocated 141.2 billion Kenya shillings to the Ministry of Health, with at least 18.4 billion shillings going into the universal health coverage. We are determined to meeting and surpassing the minimum target of 15% of the national budget to the health sector, as per the Abuja Declaration of 2001. Distinguished guests, the primary health care network tool, which Kericho County is integrating into its healthcare system, will progressively contribute to data collection on various diseases and other medical conditions. This is crucial in strategic and targeted planning, more so in resource allocation as we seek to reap from preventive health interventions. Today, we will also issue a certificate to Kericho County Referral Hospital as a level 5 health facility. The level 5 facility alongside Kaptatet Hospital must redefine medical services in this region. Besides creating a favorable environment for research and incubation of medical innovations, students will have an opportunity of shaping and sharpening their skills. Our students of the Kenya Medical Training College SIGNET campus and other medical institutions put into practice their skills at the level 5 hospital, there is potential in groundbreaking research in digital medical practices, including artificial intelligence. There is no regret in innovation. There is no waste in exploring and testing and incubating new ideas. While such institutions may not have top-notch facilities, we must leverage other research institutions like the Kenya Medical Research Institute in nurturing ideas to medical breakthroughs. Furthermore, integration of the electronic community health information system and other digital platforms require more research to improve and sustain such structures. Distinguished guests, as we raise awareness on testing and treatment of breast cancer this month, screening has been seen to contribute to reducing mortality by between 25 and 39% over the last decade. While we are registering such progress, we note that 1 in every 9 men in sub-Saharan Africa, Kenya included, is a potential candidate for prostate cancer. In this regard, I challenge the stakeholders herein to also elevate awareness of prostate cancer for our men to be tested early. Najua wanaume saa ingine mnaogopa kufanya hii test, lakini ni muhimu. This will inform timely interventions to save lives. Some countries have adopted September as the Prostate Cancer Awareness Month. We are ready to engage and propel such life-saving conversations. On this note, I wish you a successful pre-Mashujaa Day celebration. Asanteni sana. Mimi nimeshukuru sana kufika hapa Kericho tena. Nilikuwa hapa wakati ya conference ya majani chai ambaye tulianza mabadiliko katika sekta ya chai na bonus ambaye imelipwa siku chache zilizopita inaonesha ya kwamba tumeanza kuvuna matunda ya mabadiliko kwa sekta ya majani chai. Tunaendelea na mabadiliko katika sekta ya maziwa na lengo letu kama serikali ni ya kwamba lita moja ya maziwa isipungue shilingi 50, ikuwe ni 50 kuendelea 60. Again, katika sekta ya kahawa tumekuwa tukingangana na wale wenye kukatalia jasho la mkulima, na tunashukuru ya kwamba serikali yetu tukufu tukiongozwa na rais wetu William Ruto imetoa shilingi bilioni 4 ya kulipa wakulima wa kahawa, advance ya shilingi 80 wakingojea zingine, tukiendelea kutafuta soko ile tutauza direct bila kupitia hao watu ya katikati. Ningetaka niseme tunapongeza waziri wetu wa afya na timu yake kwa kazi nzuri. And I want to say for the avoidance of doubt, sit down, CS. We have many challenges as a government because of the situation we find ourselves in, the kind of economy that we inherited, the global challenges that are affecting each and every country. But in our 5 pillars in the Kenya Kwanza plan, it is obvious and it's clear that within the next 6 months, the fruits of the great work done by the CS and other stakeholders will be felt by the people of Kenya. Kwa hivyo yale yote tuliahidi, matunda ya kwanza kwa Wakenya ni mabadiliko katika sekta ya afya. Serikali yetu ikishikana na ma-counties imetoa program ya 100,000 community health promoters ambayo wamepatiwa vifaa, na leo hapa Bureti nimeshuhudia kwa boma ya mzee vile hizo vifaa zinafanya kazi, na kwa hivyo tutakuwa na afya nyumbani. Wewe utapata watu wanakuja kukusaidia pale kwa boma lako na familia yako. And this is a great intervention by government in our health sector. And I can tell you without doubt, the fruits of this intervention will be felt in every homestead across the 47 counties by the people of Kenya. Because a healthy nation is a dignified nation. I want to take this opportunity to appeal to our county governments, led by our governors also, to put their best foot forward and improve services in hospitals managed by the county government. I want to appeal to our governors, starting with here in Kericho and Bomet, to make sure that we have sufficient and adequate drugs in each and every facility of the county. This issue of patients being sent by health providers to a certain corner in the town center, to go and look for drugs should be a thing of the past. And with this digital system of monitoring drugs in the dispensaries, in the health centers, in the level of hospital, in the level 5, the governors and the officials working under them should make sure, working with KEMSA, that at any one time we have sufficient drugs available in all our health facilities to assist the people of Kenya. Mnajua tutakuwa na sherehe kubwa ya Mashujaa Day hapa Kericho katika Green Stadium. Kiwanja itafunguliwa saa 9 ya usiku. Na ni first come first served. Hiyo kiwanja ni kidogo. So amuka mapema ufike pale. Tutakuwa na maafisa wetu wa kutusaidia kuhakikisha ya kwamba mmepewa pahali ya kuketi, na itakuwa tamasha ambaye hamujaona katika area hii. Tutakuwa na military parade na other activities that are very interesting that have never been witnessed in this part of the country. I want to appeal and invite all the residents of Kericho, other neighboring counties, to come and join President William Ruto in celebrating Mashujaa Day in this county. Na tutaanza mapema kwa sababu ya mvua. Vile tumeona hii mvua inaweza kututatiza. Kwa hivyo mfike mapema, mpate viti pale mbele ndio muweze kuangalia na kuona kwa macho yale ambayo itakuwa inatendeka pale. Mimi nikimalizia ni kusema asanti kwa magavana wetu, tuendelee kufanya kazi. Na hapa Kericho, County Commissioner na timu yako, na shukuru nyinyi. Vita dhidi ya pombe inaendelea vizuri, 70%, lakini 30% bado. Nataka mutie bidii machiefs wetu. Mnajua tulikubaliana na hatuna vita, sisi ni marafiki, ya kwamba katika location yako wewe kama chief na pombe hamwezi ishi nyinyi wote pale, lazima mmoja aondoke. Na kwa sababu pombe haina akili ya kuamua kama itaondoka ama itakaa, jukumu la uamuzi ni juu ya chief. Na unajua tunataka kutoa machifu kadhaa kabla Christmas waende nyumbani, ndio wakuwe funzo kwa wengine wale wazembe. Na nyinyi watu ya Kericho mnajua ni marafiki zangu, na rais mlitupigia kura vizuri. Itakuwa ni uchungu mingi sana kwangu nikiona machifu wakienda nyumbani. Kwa hivyo namuomba kwa heshima machifu wetu, mjikaze, mtoe miguu kwa gunia, mungangane na hii watu na madawa ya kulevya, ndio nyinyi muweze kuendelea na kazi, ndio mshughulikie watoto wenu. It will be very painful for me to sanction a few chiefs in Kericho to go home because you are our people and we love you and you supported us and prayed for us. Please spare me that agony to make that decision by doing the right thing. Wale wote wanauza hizi bombe machifu mnawajua. Wale wanauza bangi mnawajua. You know them. Just make a decision and save you a job because you need it. Hii kazi kupata ni kibarua ngumu. Ile kazi kidogo huko nayo uchunge. Na mimi kwa sababu nimepewa kazi na rais, nipambane na hiyo pombe, mimi sitaki kumwaga unga yangu. So nikiona wewe unataka kunimwagia yangu, nitamwaga yako kwanza. Si ndio tunasema? Sema kuva dereva, kuva nini? Makanga. Sasa nyinyi machifu na DCC msiniangushe. Mimi hii kazi nilipewa na rais, niko na haja naye. Nataka niichunge sana. Mnajua pahali nilikuwa pahali mbaya sana. Sasa mimi sitaki kurudi hapo. Kwa hivyo mimi nikiona mtaharibu yangu, mimi kwanza nitamwaga yenu, ndio yangu imwagike baadaye. Kwa hivyo nyinyi ni watu wazuri na tumeshukuru sana. And those who are continuing with this program, tunatakia nyinyi mema na tuko na matumaini kwa mapenzi ya Mwenyezi Mungu tutakuwa na nyinyi siku ya Ijumaa pamoja na rais wetu ambaye ako huko China akingangana na watu ya huko weupe kuona atatuletea nini. Na tumemwambia rais ahakikishe akitoka tu na ndege akirudi akuja na kitu. Si mungetaka akuja na kitu? Na mumuombee asirudi mkono mtupu. Akienda tu akirudi anakuja na kitu. Hivyo ndio tumekubaliana na yeye. Na kwa hivyo mimi nataka niseme asanti. May God bless you. May God bless you abundantly. Asanteni sana. Thank you very much.
Tumpongeze tena makamu wetu wa rais kwa makofi tafadhali. Your Excellency, we have one small bit to do, so I kindly request the PS to take us through this last bit kindly.
And I will kindly, please get seated. I will kindly request you, Your Excellency, to come back on stage. You help us launch the Smart PCN. I will do a count of 3. So we help His Excellency to count 3, 2, 1, press. Behind you, on this side. A round of applause. Another round of applause. Thank you so much, Your Excellency.
Hiyo ni yetu, Your Excellency. Tumpigeni His Excellency makofi tafadhali. Your Excellency, kindly before you go, we want to kindly request you help us also award some of our kindly peers.
We have 2 awardees. Madam CS, kindly. The Governor, kindly. You can join His Excellency and CS. The first awardee is Professor Miriam Hamadi Were. Professor Were is a medical doctor from the University of Nairobi. She holds a master's and doctor of public health degrees from Johns Hopkins University in USA. She's married, as you saw. She has been the chair of the Kenya National AIDS Control Council, the chair of International Board of the African Medical and Research Foundation, a member of the board of the Global Health Workforce Alliance, amongst others. Professor Were is the former chancellor of Moi University, a member of Champions for AIDS-Free Generation, Kenya's Goodwill Ambassador for Community Health, co-founder of Uzima Foundation, and serves on various boards, among others. she has received many other honors. A round of applause for Professor Miriam Hamadi Were. Congratulations, Madam. Our second awardee is Professor Dan Owino Kaseje. Professor Kaseje was born in Asembo, Rarieda, Siaya, Kenya. He studied medicine in the University of Nairobi and later went on to train in tropical medicine and public health at the Harvard School of Public Health. He is married to Professor Margaret Kaseje and has 4 children. He has had a distinguished career in public health and global health, spearheading community-based health interventions nationally and internationally. A round of applause for Professor Kaseje. Another round of applause for Professor. And our final award goes to Kericho County. Yes, please. Congratulations, Kericho County. Thank you, Your Excellency and Madam CS.
Your Excellency, kindly, niruhusu tu nikuombe tena kindly, Your Excellency, before you go, we take a picture, Your Excellency. The last one, Your Excellency. Wapi makofi ya His Excellency, tumemsumbua sana kwa hii stage. So I kindly request all our partners, Waziri, PS, Governor, kindly join His Excellency for a picture. My co-MC, if I've forgotten anyone else for this picture, we only take in one picture and then we allow His Excellency to leave.
Na mkavile mwenyekezi mwenza amesema tuweze kumweka naibu wa rais katikati na si wengine tuweze kumflank.
Thank you so much. Basi inakaa tutasimama kama watu wa kwaya, which is okay. Camera people. Asante.
Right, as you can see on your screen, Deputy President Rigathi Gachagua just having a short photo session with some of the stakeholders who are participating in this conference, the UHC conference, just before the Mashujaa Day on Friday. And a while back we have seen him, you know, commemorating the beginning of the Cancer Awareness Month that is set to begin this month. Today we have noticed what we have observed today is that the primary objective of the UHC here has embarked, and the Ministry of Health says that, you know, the journey towards a healthier and more equitable future to all Kenyans average begins and continues. Now, right now we are having the national anthem of Kenya.
Asante sana.
Marks the end of the first part.